Welcome to the Perth and Kinross Integration Joint Board meeting of Wednesday, the 16th of February. I'm Bob Benson, Chair, and I would like to welcome you all for coming here today. I know that there are others who are watching this live who will not be participating in the meeting, but I'd like to warmly welcome you as well. And I also believe that we have a member, David Williams, from the Independent Oversight and Assurance Group on Tayside's Mental Health Services, who's observing today as well. So welcome, David. Nice to see that you're watching our work. It's nice to see you back again as well, by the way. Thank you. I'm going to go on to apologies, and then I'm going to do declarations of interest, and then I'm going to make a slight amendment to the agenda. Okay. Any apologies today, please?
Yeah, thanks, Chair. We've got apologies today from Ronnie Erskine and from our Chief Finance Officer, Jane Smith. Would you like me to do a roll call, Chair, of all members who are here?
Yes, and I believe that Donald McPherson is the proxy for Ronnie Erskine.
He is, yeah.
Okay, thank you.
Okay.
Let's do the rounds then.
Okay, thanks. Okay, members, when I call out your name, if you can just indicate whether you're actually in the meeting, thanks. Councillor Drysdale.
I'm not often at the start of the alphabet. Present.
Councillor Duff.
Present.
Councillor McDade.
Present.
Councillor Purvis.
Present.
Chair, we know you're here, so I'll just skip past you. Donald McPherson.
Present.
Beth Hamilton.
Present.
Kilpatrick.
Present.
Gordon Patterson.
Present.
Jackie Pepper.
Present.
Sarah Dickey.
Present.
And Chair Dr. Sally Peterson's advised me that she'll have to join the meeting slightly later. She had a previous commitment, so she will be joining us. Dr. Lee Robertson.
Present.
Sandra Auld.
Present.
Lynn Blair.
Present.
Bernie Campbell. Lindsay Glover. Stuart Hope.
Present.
Ian McCartney. Maureen Summers.
Present.
And Sandy Watts.
Present.
Thanks, Chair.
Okay, thank you very much indeed. Are there any declarations of interest on the agenda today? Okay, thank you very much. Before we move on to item 3, minute of the last meeting, I'd like to bring forward the item 7 about the appointment of the Chief Officer, Appointment Committee for Director, Health and Social Care Chief Officer. Thomas Glenn, the Chief Executive Officer for Perth and Kinross, is online today, and he's going to join us for this item only, and he's going to give us some important update information on this further to the paper that came out in your pack that will have implications for the recommendations within that. So Thomas, can I ask you to introduce yourself and to take us through the update information that you have regarding the appointment of the Chief Officer?
Chair, thank you very much for the opportunity to be here this afternoon to speak to this paper and to provide a further verbal update to members of the board. The paper has been prepared by my colleague Pauline Johnston, who unfortunately isn't available to join us today and to speak to the paper. So I'm a pale limitation, and you'll have to put up with that today, I'm afraid. The paper itself, I hope, is relatively straightforward in terms of what it articulates, in terms of the process that we need to go through between ourselves in the council and our partners in NHS Tayside regarding the joint appointment of the Chief Officer following Gordon's decision to advise us that he will be moving on shortly. What we have set out in the paper is that there will be a process, and I'll come to the interim one in a second, but the appointment of the substantive post, the full-time replacement, is something that we are currently looking to agree and to initiate between the council and NHS Tayside, and subject to final sign-off on the role profile and agreement between the two HR departments.
We have a slight freeze, Thomas. I got to subject to final
something there? Yeah, subject to final sign-off, we hope to be in a position to go live with that process as early as next week. There's a meeting of colleagues from HR within the council and within NHS next Monday morning. So we hope to conclude the necessary administration, and then we will look to go live in that process. The paper articulates the intention to establish a recruitment panel, and that recruitment panel will comprise 4 members of the Integrated Joint Board, 2 elected members from Perth and Kinross Council and 2 non-executive members from NHS Tayside, and they will be supported on the panel by myself and the Chief Executive at NHS Tayside, Grant Archibald. What we are intending to do is to look to initiate that process over the next week and to have that process concluded during the term of this current council, as we are very mindful that come the first week in May, a number of your appointments to this board from the council side of things may change following the local government elections. So we are keen to try and conclude the matters within the term of the current administration and using representatives from the current council delegation to the board. I will pause on that point in terms of the full-time appointment, but I wanted just to reflect very briefly on the interim appointment. We are required to look at putting in place the necessary arrangements to ensure that there is support for the team within the Health and Social Care Partnership following Gordon's departure. And as such, what we have agreed under delegation, myself and Grant, in our respective roles, is to look at putting in operational management responsibilities for an interim period, and have advertised within both organisations for an interim appointment to cover a period up until the substantive post is filled. That process closed last week. We invited expressions of interest, and again we hope over the next week to meet with the individuals who have intimated an interest and we're interested in speaking to be in a position to update the IJB over the course of the next week to 10 days in terms of an interim appointment. So that's probably as much as I want to say just now, and I'm happy to take any questions from members of the board.
Questions from members of the board?
Could I'm looking for the.
Maureen, I'll take your question then. I don't see any other names at the moment, but I'll take your question first, and then Sandra Auld wants to come in.
Yeah, well, maybe Sandra was coming in with the same thing, but I think Sandra had requested that there be a public partner on the panel for selecting the new chief officer, and I don't know if she got a reply to that. Maybe that's what you wanted to come in with, Sandra, if you want to say more.
Sandra, was that exactly what the point you wanted to make?
Yes, excuse me, it was, excuse me, so thank you very much, Thomas, for the update. Bob, as chair, as you're aware, Ian and I had raised at our last meeting that we felt it was important that public partners be involved in both this appointment and similar appointments moving forward. I understand that there was previously discussion been had where actually that commitment had been made, and I suppose I'm concerned at the fact that public partners aren't represented or haven't been considered as part of the appointment panel, and I'd really like an undertaking from the IJB that moving forward, that firstly that this will be rectified, because I don't think it's in keeping with the ethos of the formation of the IJB. It's not in the ethos of, for example, David Strang's report. It's not within keeping of the latest Audit Scotland report regarding integration. And certainly from the feedback we've had from the meeting of our reference group, which took place last Friday, there was significant public concern at that as an omission.
Thank you for that. I'm going to go straight back to Thomas on that particular part about public partners' involvement. But also, Thomas, I think it's worth reiterating what the powers of the IJB are here, as opposed to the powers of the two funding bodies. Can you just clarify that further for members?
Chair, thank you, and thank you for the questions. I think one of the things that I'm very clear on here is that this is a joint appointment to be managed by the council and by NHS Tayside, because ultimately the individual who takes up the role will be employed by one or other of the two organisations. It will not be employed by the Integrated Joint Board. It will be for us and for us to operate within our current policies in terms of recruitment of this position. The other point I would make, in direct response to the involvement of public partners, at 2.4, 2.5, we talk about the selection methods involving a range of exercises and processes. And what I would be more than happy to do, and have discussed this with the Chief Executive at NHS Tayside, is I'd be more than happy for there to be a process that involved a stakeholder group, an opportunity to meet with candidates as part of that process, but that would not be part of the formal panel process. So that would be another element of the overall recruitment process, but happy to reflect that. It's something that I was subjected to during my recruitment process, and I think it's something that has been used regularly. So in terms of looking to involve other members, I'd suggest that that's a way that we can certainly accommodate them.
Thank you very much. I hope that's clear. I'm absolutely supportive of the view that there are a number of stakeholders here, not just public partners as well, who would wish to be part of that process, not necessarily on the panel as has been requested. But I certainly know from my experience of the Angus IJB Chief Officer appointment, there were a number of quite a raft of stakeholders involved in that process who did give their opinions on the various candidates. So that was really helpful, and it did enable public partners to be part of that. But I get Sandra and Maureen's point about direction of travel, and this question isn't going to go away for us as an IJB, and we're just going to have to hold on to that. But I need to be respectful of the actual powers that we do have, and Thomas and his counterpart and Chief Exec in Tayside are the final arbiters on this, and we have to take their advice and guidance on it. The other thing, Thomas, that I wanted to ask is the process of, since we've not gone through this, certainly in my tenure, the last time there was an appointment in Perth and Kinross for this role, I'm not clear how the voting members were nominated. I'm presuming that we would have 2 from each body, but I don't know how they were nominated. I'm more than happy to take nominations, but probably I would ask that to go directly to Scott Hendry as our secretary to the board for consideration. But at the end of the day, the council will make its decisions as NHS Tayside will make its decisions on who's going to be on the panel. I certainly hope it's me. That would be really handy. Thank you. Thomas.
Well, I think fundamentally that's what the paper in front of you is seeking to do, is to seek the nominations, but reflecting that those nominations are open to the Perth and Kinross representatives and to the NHS board members. So that is a question which is being posed just now to the joint board, and it's for yourselves to agree who those nominations are. But again, reflecting that those need to be a council or an NHS Tayside appointment to the board. So I think that is over to yourselves in terms of that one.
Okay, are there further questions?
Chair, yes, you've got questions from Councillor Purvis, Patricia Kilpatrick and Councillor McDade, Chair.
Yeah, they're not appearing on my list as they should be. Okay, right. I'm going to take Councillor Purvis and then Patricia Kilpatrick. Sorry, Pat, I'm using your formal name. And then Sandy McDade and Eric Drysdale. I'll take them in that order. Councillor Purvis.
Thank you, Chair, and thank you to the Chief Executive of the Council for that update. I do think the paper was quite scant on detail and certainly didn't provide me as a board member with assurance over the interim arrangements. I am somewhat more assured, but would be very keen to have final clarity on what the interim arrangements will be before we actually don't have a chief officer next week. So I would make that plea. On the appointment process, while I appreciate the unique situation of this appointment being a joint appointment between the 2 partner organisations, as far as I'm aware, I haven't seen a paper to any council committee on this. So if it's a council involvement in the process, then I would be keen to know when that's coming forward and the council being able to have its view, because in the same way that chief executives and chief officers are appointed, ultimately that process starts with elected members, but I haven't seen that. I do share the concerns that that Sandra Old has about the lack of involvement of public partners, and did have some conversations with the head of legal and governance services at the council about this. I think that it's very welcome that the public partners will be involved in the assessment centre process and at some of the stages, but I think the issue here is that public partners are supposed to be fully involved in all ways in the IGB, the only difference being that at this moment in time they just don't have a vote, and not being fully involved in the panel process I think would undermine that role that is so vital that they play. So I would ask if the Chief Executive and his counterpart could consider their full involvement in the process. I think that's only right and appropriate.
Thomas, rather than replying to each of these questions, I'm going to take 2 or 3 more and then you can bring them together. There may be similar points made. So I'm going on to Pat Kilpatrick and then Councillor McDade and then Eric Drysdale. Thank you.
Thanks, Bob. I do think it's a very good point that Sandra and Maureen have made, and it's with some dismay that I feel that public partners are not having a more formal role in the appointment. So I'd like to record that, and I think they should be. If that can't be accommodated, I think at the very minimum we should have an informal process where we allow candidates to do presentations, as we do all the time into senior jobs, and a very large group of people are invited to be part of that and to ask questions and also to score candidates, and all these scorings are usually accounted for and are fed into the interview panel, so that the interview panel are not just seeing the candidate on the day, but are also getting a very rich picture of how the candidate is perceived to have performed in a range of different audiences, if you like. So I think this paper it does not go far enough to address this, and I think you need to take it back and work out what the paper actually should say, and that there should be a more democratic approach to how we appoint, given that we you know, we're not paying lip service to public partnership here. We're trying to really make it a meaningful and engaging process where people have a lot to contribute. After all, these are the people who will be using the services, and not people like me. So I think that's a really important issue. My second point is, I think, again, the paper doesn't say enough about interim arrangements and how that will be managed, and, you know, if people will be acting or whatever. And I think that's really important. We don't want to have a rudderless ship in a period, an interim period, where we're out to appointment. And I think, you know, this is an important, really important issue for the IJB, and I'm sorry, but I just don't feel this paper is really addressing the key issues. Thanks, Bob.
Thanks very much indeed. I'm going to take Councillor McDade and then Eric Drysdale.
Thank you, Chair. I have a number of questions on this as well, and I would support the views expressed by Pat Kilpatrick, Councillor Purvis, Sandra Auld and Bernie Campbell. I want to understand 7.1 of the integration scheme sets out the Integration Joint Board will appoint a Chief Officer in accordance with Section 10 of the Act, and the Chief Officer is accountable to the Integration Joint Board for integrated functions delegated to the Integration Joint Board under the scheme. It then says in 7.2 that the Chief Officer will report to the Chief Executives of the partners. So my take on that would be that the partner bodies host the employment of the Chief Officer on behalf of the IJB, but that the IJB, the Chief Officer is the Chief Officer of the IJB as per the Act, and therefore it would be for the IJB to determine the panel arrangements, etc. For this, and that it would not actually be the Council and the NHS setups, but actually it would be for this board to determine that. So I'd like some clarification on the legal parameters around that. I'd also like to understand why 7.5 of the integration scheme, which says a member of senior management team of one of the partners will be designated as the Deputy Chief Officer, has not been implemented, which would resolve all the concerns that we have around interim arrangements had one been delegated. So if I could have answers to those questions, I'd be very grateful. Thank you.
Thank you very much indeed, Councillor McDade. Councillor Drysdale.
Yes, thank you, Chair. I don't as such have a question, as I've indicated in the chat. At the appropriate time, if we reach that, then I did have a nomination to make. But whilst I have the microphone, I would just comment that throughout the last year, especially, we have made it very clear as a board that we are keen to enhance the role of public partners in all aspects of the business. But you know, and I know that we are constrained in so doing in terms of voting membership as a result of the terms of the integration scheme. But you know, we have done other things over the last 12 months to try to enhance that role, and I would just urge that, recognising the views of the meeting, that whatever role can be found for public partners should be found within the terms of the rules governing the Integration Joint Board, insofar as that is possible. And I would, I guess, seek that there be further dialogue, possibly offline if we're not going to resolve it today, to try and address that. You know, on the one hand, a selection panel or appointments panel or whatever it's going to be called can't be too big. But I do think that we absolutely do need full representation from councillors and from NHS board members. And you know, picking up on Thomas Glenn's comments, I would urge everyone to try and find a way to maximise the level of involvement of the public partners in this process.
Thank you very much indeed. I'm going to take one other question from Beth Hamilton, and then I'll ask Thomas to respond to these points.
Thank you, Bob. Kind of playing devil's advocate here in the sense that I really do endorse the comments that everybody's made about engagement of as many people and stakeholders as possible. But what I'm picking up from Thomas's initial comments around the paper was that the meeting is still to happen with both organisations and the HR. And I think that's probably where they would be deciding the kind of process that I imagine Pat referred to, where we have a wider group that will be able to engage with each candidate through a presentation, etc. So I'm just thinking the clarity around that, when Thomas mentioned that, is at the time when you would be arranging for us all to be able to hear presentations, because then we would get the range of stakeholders rather than one specific carer or service user organisation.
Well, thank you very much indeed. Thomas, a range of issues there. Part of it is around the integration scheme itself and the powers of the IJB, but also about the process involved as well, and a very strong pitch for the involvement of public partners. And I think I would share some of that sentiment myself, I should say. Thomas.
Chair, thank you again, and thank you to members of the board for their comments and for their questions. What I'm not intending to do today is to rehearse some of the wider conversations that are ongoing around about the integration scheme and around about the various roles. I think they're for another time. What I am concerned with just now is about progressing the interim and the substantive appointments. So I'll focus on those and look to address the questions that have been posed. And I'll begin with the last question, but also pick up on part of Councillor McDade's comments regarding the interim arrangements. So we have a meeting of HR officials on Monday. Myself and Grant Archibald have reviewed the role profile. We have implemented a process within both of our organisations, which I believe is consistent, having spoken to the Council's Chief Operating Officer and Monitoring Officer in terms of the requirements of the Act, but happy to respond to Councillor McDade on that. But we have initiated an interim process. We have expressions of interest in that process, and we will look to use that interest and to meet with candidates next week and to put in place an interim appointment which will minimise and hopefully negate any period of overlap between Gordon leaving and an interim post holder coming into place, and they will be managed through whatever acting up arrangements are required, whether that appointment is a P&K official or whether it's someone from NHS Tayside. In terms of the broader issues that have been raised by, I think, everybody's contributions round about the involvement of public partners, again, I think I've been very clear that this is an appointment by either the council or the health board as the employer, and as such that's why we've taken the approach. We are keen to make appropriate use of public partners in that process. As outlined, that there will be an assessment centre, and as such you have my commitment and that of the Chief Executive at NHS Tayside that we will build in the opportunities for that assessment centre to offer opportunities for public partners to be involved in that process. Now, the details of that I will leave to those that will design the selection process in the assessment centre, but the commitment's here to ensure that partners are involved in that and have an opportunity to meet with candidates as part of that process.
Thank you very much indeed. And I see that before I bring in Scott, Councillor Purvis, I take it the Chief Exec has started to address the question in your chat line on the legislative aspect. Would you be content for me to?
I don't think he has, to be perfectly honest.
All right.
I think Councillor McDade made reference to the integration scheme, which refers to Section 10 of the Act. And on looking at that, and as far as I'm aware, it looks to be unamended at the moment. It says the appointment's for the IGB and that we have to consult with partners in advance of the appointment, but doesn't say it's for the appointment to be made by the partners. That was certainly my understanding of the position previously until we had this paper. So I'm just looking for clarity on that. Because it seems what we're being told is inconsistent with that. I'm happy to be corrected if my understanding of that is incorrect, but it seems quite explicit.
Okay, I'll come back to that in a moment. Scott, do you want to come in on that point or to do with the paper?
Yeah, really on kind of both areas, just to pick up on those points and also reiterate what Thomas is saying. And I did have a discussion with Lisa Simpson, the legal advisor to the board, prior to the meeting, who'd been involved in the previous discussions as well. I think the approach that we're trying to take in bringing this to the IGB for agreement acknowledges both the fact that yes, in terms of the legislation integration scheme, it is the IGB does have a role in appointing the chief officer, but acknowledging the unique role that the chief officer has in that they are a director of both NHS Tayside and the council, and as part of that they act as the chief officer for the IGB, and they're actually a non-voting member of the IGB. We thought that the logical governance route was to allow the IGB to appoint the members who will then also act as who come from the voting members of both NHS Tayside and the council. Yeah, I pick up on Councillor Purvis's point about the proposal that also be ratified by both the council and the NHS Tayside board separately, and I don't see any issue with that if that's what the board is suggesting. But I think that the logical governance route would be for the IGB, drawn from the voting members of the councils and NHS board, to make this appointment. And I think my advice would be that if the board can make an appointment today, as Thomas has outlined in terms of the process, acknowledging as well the role of the public partners in a stakeholder group, I think that would help in terms of the process.
Okay, what I seem to be getting here is that there is still an uncertainty from the IJB board about this process. And I think we need something a bit more in writing about this process, just so that board members feel comfortable that the legal requirements have been met. And probably we need to have something more. And it's a shame that, as the Chief Exec said, it's a shame that Pauline Johnson wasn't here today to further clarify that. But the other point from me is that I'm really, I'll say, anxious about leaving a gap, and particularly in the interim arrangements. And I think we need to make that appointment as quickly as possible so that we can support our staff through what has been a really difficult situation. In terms of the substantive role, I think that obviously requires more clarity in terms of the process of voting members in it. And what I'd like to do is I obviously can't carry this report today in terms of its recommendation from the voices that I've heard so far. And I think what we need is a refresh paper that can go around, and we'll have to deal with it either in a separate session or we have to deal with it online because we have run out of time on this. But I do affirm that I want to have the interim position from existing staff appointed as quickly as possible. I believe Gordon's got about 10 days or so before he goes, so it's important that we have someone at the helm. We can't have drift. But for the substantive role, I do want to see consideration to some of the views that were conveyed today, not least being the bit about public partners, but I do want to make sure that we have covered the legal elements. Scott says that the council and the NHS Tayside have done so, and the chief executive of PKC has been delegated to take this forward. And I would be content for that to happen with the interim arrangements because of the urgency of that. But with the substantive role, I would certainly wish to see more clarity around about how we seek voting member nominations, because there may be a number of people who'd be interested in that, and also to reconsider the role of public partners beyond what was expected. And I think that seems fair to me. Are board members content with that approach?
Yes, Bob, I think that's a good approach. I think the paper needs to come back and be a bit more comprehensive in its approach.
Likewise, I would be in agreement with that as well. Thank you.
Other members?
Yes, Chair. I mean, I'm supportive of your proposal there to get more detailed proposals circulated by email for the board to consider. Can I ask, as part of that, I would quite like to see detailed legal advice to the board regarding the position in terms of both the integration scheme and the Act, and how the proposals comply with that legal position, ideally from either the head of legal and governance council or similar, a lawyer from either of the partner bodies. But I would like the legal advice set out quite clearly on this, please.
And Thomas, I'm still waiting other feedback from other members here, just
Sorry,
so that
Chair.
I get
Also,
feeling forward before I bring you back in. I'm reading it. I know that Sandra All's having difficulty coming in. Are there any other comments from board members? I get the view that people are supportive of the approach that I outlined. Thomas, can you come back to us? I believe you've got a comment to make.
Chair, I'm conscious that Councillor Purvis wanted in and be happy to defer to him before coming back.
Oh, I'm sorry, Callum. I missed you on my list. Sorry. Please come in.
Thank you, Chair. I know you may be having some delays with the chat, and certainly my end, it seems to not be delivering straight away. It was just to say I'm happy with the approach that you've outlined. However, I think that there is still an urgency to this. And while I've raised issues, as have others, and I think it's absolutely imperative that they are resolved to our satisfaction, we also need to do it quickly. So I would be keen that, if possible, a special meeting could be arranged to make a final decision on this, a week or so's time, because I don't think we have ages to leave this. Absolutely get the issues right, but I don't think we can leave it too long beyond that.
Thank you very much indeed.
Yes.
Thomas, are you coming in? I'm sorry, I'm seeing other chat stuff here. I think, Thomas, you want to come in.
Thank you, Chair. Yeah, that's helpful again. As I said a couple of times now, and hopefully I'll articulate it clearly, in terms of the interim appointment, we will be in a position to update the board by, I would anticipate, the end of next week, and that will be with a view to trying to minimise or to remove completely any period without a chief officer, an interim chief officer being in place. So again, that's a commitment I'll make to the board in terms of an update on the interim appointment. In terms of the substantive appointment and the process that we are setting out in the paper, and happy to provide additional information. Again, picking up on Councillor Purvis's comments, I think there is absolutely an imperative for us to have agreement on who will be representing the IJB through the Council and NHS board nominees. So I would absolutely concur with what Councillor Purvis is saying. We are not keen to delay that process any further than we have to, and any potential delay would potentially take us beyond May and into a new administration for the council and potential new IGB board members being nominated. So I'd be keen for us to get to a conclusion as quickly as we can. The process that we have set out, following the advice from officers within the council, and I'll ask them to articulate that in writing, is that this is consistent with the legislation and consistent with the integration scheme, in that the IGB is being asked to nominate IGB members, but those members are representatives from the Health Board and from the council. And the further offer which I've made and will continue to make is that we will look to involve public partner members in the assessment centre process and in the selection. So again, that commitment's on the table, but I will pick up on the request for the legal position to be articulated to members.
Thank you very much indeed. I'm going to wind this up because I think I have the general tenor from the IJB about their wishes. So we're content for the interim position to be filled as quickly as possible. But further to that, for the substantive role, I think we need a more detailed paper on this, not just on the legal position, but how we actually go about nominating even voting members here would be quite helpful too, and how we make decisions on those. That would be helpful too. But thank you very much indeed, Thomas, and I greatly appreciate you stepping in at short notice to address this really important issue. Thank you very much indeed.
Bob,
sorry,
Bob, would you mind if I just say one final thing? You've just reiterated again there about voting members. There shouldn't be a discrimination between IGB members, between voting and non-voting members. We public partners are full members of the IGB and shouldn't be discriminated against because we don't have a vote. And I just want to make, that clear. I mean, we've heard again very recently where papers have been circulated to the board and they only went to voting members. And I know that that's an administrative oversight, but this is important. This is an important point. Thank you.
Thank you, and your point is well made. But I'm not just being. I'd already made the point about the importance of the role of public partners, but also I would like some clarity for voting members as it currently stands, really. So that's the other part I was trying to clarify. I wasn't taking anything away from that other point you were making, which is well made. Thank you very much indeed. Thomas, thank you. A lot to think about, and we look forward to getting a paper back in some form, and if we need to convene a meeting to discuss it, we can make that decision, and I will consult with the Vice Chair and with Scott Henry on this process.
Chairman, sorry, Scott, I'll let you come in first.
Sorry, Thomas. Sorry, just briefly, just to pick up on Sandra's point, I think as a standard of the board, I'm concerned about the use of the word discrimination, and I think I can see where Sandra is coming from in relation to the involvement of the public partners, but I want to be clear that I don't see any discrimination. I think we need to be key about the role. The reason that we're mentioning the voting members is because they are also acting as they come from Perth and Kinross Council, NHS Tayside, and they have that dual role in appointing this unique position. So I don't think it's that anyone's trying to discriminate between a voting and a non-voting member of the IGB. It's distinguishing that because the voting members are Perth and Kinross councillors or NHS board members, that's why that distinction being made in relation to this process. So I think, but I also take the point that you've made about the public partners and other non-voting members being involved. That I'm glad to see that we're taking that on board. So, Thomas, I'll let you come in.
Scott, many thanks. And again, I don't want to go over old ground here. It will be for the board to make a determination based on the paper, but clearly that's a decision for the board in relation to the Perth and Kinross Council and the NHS Tayside. And I've heard the questions posed in terms of the public partner involvement. My final comment, Chair, was just to thank you for the opportunity, but more importantly, given the nature of the occasion today, just to thank Gordon for all that he has done, and I know there will undoubtedly be comments from others later on, but I'll be leading the meeting, so I would just like to put on record my thanks to Gordon in the short term that I've been in post here, but acknowledging the contribution that he's made over the years that he's been with the council and his role within the council as well as his role within the IJB, but I'll leave others to add to that later on. Thank you, and I'll take my leave.
Thank you so much, Thomas, and Gordon's going to be truly embarrassed today by the end of the meeting. Thank you very much indeed.
Thank you.
Thank you.
Goodbye, folks. Bye-bye.
Right then, thank you very much indeed for board members' contributions to that item. And I think one of the things I take away from this is just how important these issues are for us in terms of this figurehead role within the organisation, how important they are, and being fully clear on what the processes are and what our powers are as well. But thank you very much indeed. I greatly appreciate the conversation that we've just had. So I'm now going to go back to the agenda again. And Gordon, are you still there? Hi there, Gordon. Thank you. I think you'd be fortunate you don't have to be involved in any more processes around the reappointment of the chief officer, but I just wanted to bring you back in again to say is that towards the end of the meeting, we would want to say a few words about your contribution, and I'm really glad that Thomas Glenn managed to say a few short words to you as well. I greatly appreciate that. I'd like to go back to the agenda now to item 3, minute of the meeting of the Perth and Kinross Integration Joint Board of 1st of December for approval. Now, before doing so, can I check the accuracy of the minute, please? Are there any comments on the accuracy of the minute? I guess there aren't any, I'm not seeing any coming up. So I'm just assuming that people are content with the accuracy of it. I'd now like to formally approve this. Could I have a proposer and a seconder, please? Pat Kilpatrick. And I don't see anyone else at this stage. Does anyone see another hand? I'll take John Duff. Thank you very much. Okay, now that takes us to action points update. Okay, who's going to speak to these?
Thank you, Chair. I'll take these items if I may. Thank you. So we've got 2 action points that I need to update the IJB on. The first is reference 131, and this is around the ongoing work that is being progressed in relation to the development of a financial framework to underpin the Tayside-wide mental health strategy, Living Life Well. Not very much to provide by way of update. The work, as I understand it, continues to be being advanced. The Director of Finance in NHS Tayside is having ongoing discussions with the 3 Chief Finance Officers from the Health and Social Care Partnerships. However, inevitably at this time of the year, budget planning is now demanding some attention, and there is also some ongoing discussion taking place around how best to manage moving forward the inpatient mental health budget. So we should be optimistic that that work will be progressed. I think it is key. It is something that the IGB have previously highlighted, and that's obviously why it's an action point today. But particularly given that Living Life Well was considered and approved provisionally by all three IGBs probably over a year ago now. I see Maureen probably wants to come in on this item, Chair.
Yes, it was just it's okay, it was approved about a year ago, but as the action has been done since, or rather lack of action, and although there has been a lot of money poured into mental health nationally and locally, it's the way the money is being spent that is a concern, you know, to you know, members of the SPG, and also a lot of you know, professionals as well are sorry that a lot of the money is still being poured into inpatient services, and that you know, and rather than, you know, in services in the community, which is for early intervention, you know, and prevention, which is key in, you know, getting people, you know, attention quicker than saving the inpatient services, you know. So you know, there doesn't seem to be, you know, any movement in that. We've also were promised when Kate Bell left about a year ago that we would have a subgroup set up to look at other options for centralisation of inpatient beds. I don't think there's any problem that it needs to be centralised, but it's the fact that it's centralised at Carsview is a problem, because following the Strang report, you know, it was more or less universally agreed, not just among service users and carers, but also most of the professionals that were on that group, that a subgroup should be set up to look at other options for centralisation, and that's never been done. It was brought up again at a meeting last week that one of our SPG partners, he's involved in the board, and it was announced by Claire Pearce that this was set aside for the moment. It's been put aside. Now, we know that Fiona Lees is in with a team that's it's overseeing the progress that's been made in mental health services, and I'm afraid that going by, you know, the past experience, that it looks like it's being postponed until Fiona Lees and her team are out of the way, and then it won't be monitored. But this should be progressed now. I mean, we're already a year late since Kate Bell left nearly a year ago now, and that was at her last meeting. It's more or less agreed that that was the best way forward, to set up a subgroup, and that's never been done. So the inpatient services have not been progressed. They're still carrying on as usual. They're a big drain on the budget. Also the use of locums, that's never changed, you know. They still use locums most of the time, which is not fair on the patients, because they have to tell their stories over and over, you know, rather than have a psychiatrist there, you know, for a reasonable length of time. So we feel that nothing is really changing in NHS side, I'm sorry to say. So, you know, that was just,
can I come in here, Maureen?
Yes.
I think you've made your points well.
Yeah.
Gordon, do you wish to respond to any of these points?
No, I mean, I think Maureen makes good points. She makes them well. She makes them from a very well-informed perspective. And, you know, I share, as the Health and Social Care Partnership does, and I'm sure the IGB does, the desire to shift the balance of care to get to a position where we are better equipped, better able, better invested in to deliver a robust community service that diminishes the need for people to go into hospital and enables them, once they are in hospital, to come back home and be supported in the communities for as long as possible. I'll maybe say something about that in my next update, Maureen, because I think you've already picked up on that. So the second action point that I want to say something about is in relation to concerns that have been raised by the IGB around, as Maureen described, I suppose ultimately the decision that was taken by Perth and Kinross IGB 4 years ago now around the centralisation of services, but much more recently, towards the tail end of Kate Bell's time working in Tayside, the rapid review of that decision that was taken forward. And as we described at the last IGB, there were 4 workshops in that regard that Kate and colleagues chaired, and that was to review whether or not that centralisation proposal was valid, or whether or not there were alternatives. And as I indicated to the last IGB meeting, and is as captured in the minutes of that meeting, we know that the stakeholder participation group were unhappy that at the 4th workshop only one option was being presented, and that was Car's view. So Maureen is absolutely correct that the intention beyond that, because of that disagreement, was to set up a short life working group to explore the options. I can give a bit of an update today in relation to the proposed plans, or the proposals for taking forward the strategic planning of mental health services across Tayside. So firstly, it's probably important to say that the integration scheme recognises that the responsibility for strategic planning of mental health services in Tayside sits with the IGBs, and sits in particular with Perth and Kinross IGB. And the revision of the integration scheme is likely to reaffirm that. That I think is something that for which there is agreement across the system. So while Kate Bell had led on this for a year, and while Kate was at that point taking on the responsibility for strategic planning, as we know, in response to the Trust and Respect report, Kate was key to the delivery of Listen, Learn, Change, and then Kate was really the driving force behind the Living Life Well strategy. So whilst the strategic planning responsibility for mental health services sat with the IGB, I think the IGB was recognising that that work was being advanced, and was probably reasonably assured that because that work was being advanced, they would be updated periodically, and certainly that was the case. I mean, perhaps technically, given where the responsibility lies, Kate maybe should have been reporting to the 3 IGBs, but as it was, because of the circumstances and how she arrived, Kate reported directly to the Chief Executive of NHS Tayside and into the NHS board. However, as Maureen rightly points out, there hasn't been anyone in that post since Kate's departure, and I'm able to advise the IGB today, by way of an update, that it is now the case that it will be these responsibilities in relation to strategic planning for mental health will revert to the Perth and Kinross Chief Officer for that post to lead on. And the reason for that is because the extant job description describes that as the responsibility of Perth and Kinross Health and Social Care Partnership Chief Officer, and the Chief Executives intend that that should be the model moving forward, because it's in the existing job description. So what I would imagine, Maureen, is if the posts appointed on that basis, that the Chief Officer in Perth and Kinross would take on responsibility again in relation to the mental health and learning disability service redesign programme, what you described as centralisation of services. And you know, the IGB will know that that was about mental health services being centralised in Dundee, learning disability services in Perth and Kinross, and a plan to move away from the provision of Strathmartin Hospital. So the post would be responsible for that, as well as presumably now the work that has evolved and developed over the last 2 years. You know, Kate was here for a year, she's been away for a year. Listen, Learn, Change, Living Life Well would fall to be the responsibility of the Chief Officer in Perth and Kinross. And that would hopefully enable that post and that post holder to take forward some of the actions that the IGB have been concerned have not been able to be progressed in the absence of that responsibility reverting back from the NHS. So I appreciate that's fairly complicated. It's an update that is a reflection on the decisions that have been made on the basis of my post, this post about to be being advertised, and a recognition that the existing job description has as responsibility for the Chief Officer to transform mental health services in Tayside to achieve cultural change and financial sustainability. Thanks, Chair.
Thank you very much indeed, Gordon. Well, that's a pretty compelling narrative. I'm going to take Councillor Purvis here.
Thank you, Chair. Thank you, Chief Officer, for that update. If I could just work through a number of the points there. I became aware yesterday of the fact that the rapid review was not being progressed through the Short Life Working Group, as had been previously promised, which I think is disappointing, although given what you've now articulated, perhaps explains the rationale for not progressing that. I am still slightly concerned about the what you've outlined in relation to responsibilities for inpatient mental health. I've made no secret that my preference is that inpatient mental health is, fully the responsibility of Perth and Kinross Integration Joint Board at a strategic level, as was the case previously. But I appreciate that part of the problem was in terms of operational capacity and the ability to deliver some of those things within the IJB. And my worry would be that without necessary arrangements being put in place, and that would be what I would be seeking assurance from any new Chief Officer, would be that wouldn't lead to similar problems as we had in the past. I think there's also an issue to be considered around the fact that the budget has been transferred from Perth and Kinross Integration Joint Board back to NHS Tayside, and we are no longer, as part of the NHS budget, the health side budget, looking at inpatient mental health. How can a Chief Officer have responsibility for financial sustainability with no control over the budget? That just doesn't make any sense to me. So, while I, as I said, in principle, support the strategic responsibility sitting fully with the IJB and the Chief Officer, if that management capacity can be put in place, I do wonder whether this is just further causing problems in terms of having a lack of clarity over who's responsible for what. I wasn't happy with the arrangements that the Scottish Government had imposed on us, but I think we had got to a stage of at least understanding who had responsibility for what. I think that this change may muddy the waters further, and so that is my concern. And I suppose the last part would be a question to the Chief Officer, if you indulge me, Chair, on the Short Life Working Group. I am concerned, given how long that has been underway, and from the information I had received and part of your update, it's been suggested that will be paused as part of a wider review of the integration schemes, which my understanding was that was underway anyway. I would like to see that progressed quickly. I appreciate you're not here for much longer. Is there any way that we can ensure that is progressed quickly, even if that's through a formal direction to NHS Tayside, or with these new arrangements, would it be that there would be no need for a formal direction because it would be a direction to the Chief Officer? So I know you might not have an exact answer, but I think it is really important that we progress this quickly. And is there a way we can do that?
Chair.
Gordon, can I bring in Beth Hamilton? She may wish to cover some of this point as well, and then I'll ask you to respond, Gordon. Thank you. Beth Hamilton.
Thank you, Bob. I don't think I particularly want to cover what Councillor Purvis has just said, because that's something different from what I was commenting, and I agree it would be really good to get a bit of clarity around that. What I was really more concerned about was Maureen's sense that I was getting of feeling that nothing is happening within Perth and Kinross around mental health and everything is focused on inpatients. I know I've only been on the board for less than a year, but I had a sense of optimism around mental health with our local strategy or strategic delivery plan that we've approved, some of the progress that we've been making in Perth and Kinross, and I was feeling assured that we were progressing quite well within Perth and Kinross and engagement with stakeholders, etc. So I suppose my question is, do we need further assurance that that is happening at a local level? I accept we have issues within a whole Tayside wide, but I would appreciate some assurance that I have not picked up things in a rather naive and positive sense when things are not as positive. Maureen,
Yeah, I just want to come in there and say that, yes, one thing that I think is the envy of Angus and Dundee is that in Perth we have the nuke has been set up, you know, and they have some acute beds that people can, they can go there and even self-refer, and they get a bed for the overnight until they have an assessment to decide, do they need to go into hospital or can they go home with extra support? And that is great because they don't have that yet in Dundee or Angus are still working on that. But that wasn't funded by the NHS. That's, you know, it's independently funded. This was set up by, you know, a couple who run. So, you know, it's not thanks to them. You know, what I'm concerned about is the money that is still being spent because of the focus on, you know, inpatients rather than, you know, in the community. There's lots of other work, you know, setting up groups and things in the community that could, you know, help, you know, prevention and early intervention without, you know, the focus being necessarily on and definitely the fact that Carsview has been the result of a TV programme, and it's I mean, I've been there myself. I went there as part of a visit with the Perth and Kinross IGB 2 or 3 years ago. I'd never actually been in it, and honestly, you would be better in prison. It's so, you know, not conducive to, you know, healing mental health. It's a long corridor with doors off right and left. There is no outlook. There is nothing that would, you know, lead to a therapeutic healing of people with mental health problems, especially people in crisis. And it's definitely not a fit for purpose building. And that was generally agreed, you know, a year ago before Kate Bell left. And we're no further forward. You know, I think as NHS Tayside really wanted to be at Carsview, so nothing is going to change, I think.
I wonder if I could come in here because I mean some of the statements have really been already made, Maureen, and I really get the urgency around about this. I think we have to decide about where we go from this, because there is a degree of urgency about some of the points that have been made about are we assured, are we getting different messages about assurance around about progress. And that's quite important, and I'm almost certain that will be something Eric and I will have to have a debate about on Monday. I'm looking for a way forward in this. I think we need to have Claire Pearce here to talk to us at our next substantive meeting on this issue, to give us some of that reassurance. But it may be beforehand that a note comes from the IJB through me, outlining some of the issues that have been raised to this action point, that perhaps Chief Officer could perhaps summarise very briefly for me, because I think these issues are not going to go away. They have been familiar, but I'm mainly concerned about the different messages I'm getting about change or not enough change, and particularly the work about the short life working group. So I would like to progress this, and I wondered if that would be a way forward, but I do think we need to have Claire Pearce here anyway.
Chair, can I come in?
Yes, please.
So I mean, maybe if I could start with Beth. Beth, I don't think that your positivity around the development and delivery of a community mental health and wellbeing strategy in Perth and Kinross is misplaced, and I hope she won't mind me saying it, but I think Maureen was supportive and active in the development of the community mental health strategy. You know, this is a strategy that has provided support to 8 or 10 third sector organisations to develop low-level interventions. It's a strategy that has employed a GP lead for mental health. We've got nurses in 9 nurses working specifically in GP practices with mental health as their specialty. We've brought in additional posts into our social work intake team to provide a mental health triage and support. So there's absolutely lots going on in the community, but within the funding envelope that we have, rather than necessarily achieving the ambition that we might want to deliver on. So I hope it's the case that you should be reassured that there's lots going on. And it was only as recently as the 1st of December, our last IJB, when the IJB approved that strategy, having had, I think, a very positive development session the week before. So hopefully, and I regret I won't be here to see this through, that the strategy will continue to do as much as it can to try to keep people well, to keep them local, to keep them connected through marshalling the resources of the third sector, through volunteers, through supporting carers, and through statutory service intervention. So that remains our commitment, and the IJB should challenge my successor and others on the effectiveness of the implementation of that strategy. Councillor Purvis raises some very good points, and some of them are comments, and I might share his views in relation to some of that, because I think it becomes quite difficult for my successor to deliver on the strategic planning for all mental health services when someone else, and I can't confirm who that will be, is going to operationally manage inpatient services, given what we're describing in relation to where significant expenditure is incurred. I think probably in my previous updates to the board, I had anticipated that the post that was proposed at that point, the Director of Mental Health Services, would have both had the responsibility for strategic planning and would have reported to the IJBs, and would have had the responsibility for the operational management. So the person who is managing the service could be closely involved in the future planning, the delivery and the design of future models and future pathways that support that shifting in the balance of care. However, the job description is very clear that the Chief Officer in Perth and Kinross will take on that strategic planning responsibility. The question thereafter is how will that be resourced? And Councillor Purvis highlighted that. So that's something that I think needs to be progressed. We need to be clear about how that will be resourced in order that, our shared commitment to improving and redesigning and developing new approaches to support people who have mental health problems in Tayside, that commitment is matched by a level of investment that enables us to finally deliver on that. This has been one of the most challenging areas for NHS Tayside and partners for many years in Tayside, and it would be I'm very clear that the Tayside executive partners collectively have a shared ambition to address this, and hopefully that ambition will be matched by the resources to enable that to happen. Because the Chief Officer has a number of other responsibilities, and I haven't been wearying for things to do for the last 3 years. So I think it is important that we get that clarity. We're beginning to get it. The Chief Officers will be responsible. The IJB will retain its responsibility for strategic planning. The job description will articulate some of that. The appointment will be on that basis, and the discussions that are taking place across Tayside executive partners should help to give effect to that direction moving forward. And within that, there is a question about 4 years on, whether the mental health and learning disability redesign programme and the scale, the scope, the significance of that programme is still evident for those of you who want to look at NHS Tayside's website. That is a significant undertaking that will require to be resourced. But there is a question, and well, there may be a question about whether the extant proposal that emanated from all that extensive work remains valid or should be revised and reviewed in view of the fact that we've moved on and we've had the pandemic and other things have come to pass in the intervening period. But that will maybe be for the governance board that oversee and direct, a programme board or the IJBs who oversee and direct how this work will take shape moving forward. And again, that will need to be designed and built into the approach. So those would be my reflections on it. I hope that those are helpful. I think it's important that we've got some clarity moving forward, and the comments that have been made, I think, are all valid and helpful. So thank you for that, Chair.
Thank you for that, Gordon. I suspect for some it will not give the amount of clarity that you're hoping will happen. So we're very much looking forward to the interim chief officer to advance this work until over the short term. So that means that we won't be able to revisit this matter until our next meeting in March, at the end of March, formally. I still would like to have Claire Pearce here for that discussion, if we can make that as an action point. But you're absolutely right. There's a whole lot of things need to be taken forward on this, because I'm just simply getting too many mixed messages about this, and there are a number of issues that are outstanding, I think, round about the role, given that I think we understand that there have been changes made to the overall responsibilities that were first enacted. But we'll come back to that with the new chief officer to take that work forward. Thank you very much indeed. And that
Chair, there's a further comment from Councillor Purvis, I see.
Oh, sorry, Callum, I missed that. Thank you.
Thank you, Chair. Sorry, I really don't want to draw this out too much longer, but it's just on this issue of the rapid redesign and the rapid review and the short life working group. You know, it has been 11 months since it started. Now, I know that part of the issue has been because the stakeholders quite rightly weren't happy with how it happened, that it's taken a bit longer, but we need to make sure that we get it right. I'm just concerned that if we're leaving this until after the new chief officer is appointed, that could be, you know, May at the earliest, or if there's notice periods even later. I suppose, Gordon, is there any, and that was coming back to my question, is there anything that we can do, and who would it be we would be giving that direction to? Would it be to your interim successor, or is it still until the new chief officer is appointed at NHS Tayside? Because I would like to see the work done, even if not a final decision is taken, but I would like to see that work started again imminently. I think to wait until the review of the integration schemes, which has been going on for quite a long time, is not really good enough. We need to do this quickly. So your advice would be appreciated in that.
Yeah, I see Maureen wants to come in. Maybe bring Maureen in and then respond to both, if I'm able to. Maureen, on you go.
Yeah, I'm pleased that it's come back to be the responsibility of the chief officer in Perth and Kinross, because does that mean that we can actually start that process now? We have the authority to, you know, get the ball rolling again on that, and because it was taken away from Perth and Kinross and put to the, I think it was the Tayside board actually. You know, we didn't have the responsibility for inpatients and or anything like that. It was taken away from Perth and Kinross just shortly after that decision was made 4 years ago, which I have to say was a wrong decision. But anyway, that's why we're where we are now. But another concern is that because Claire Pearce made that announcement last week that has been set aside for the moment, this, you know, kick-starting this process, does that mean that it could well be delayed until after Fiona Lees and her team, who are overseeing, you know, the progress that Tayside are making in the mental health? Because, you know, after that, there won't be a lot of accountability, I'm afraid. Like, you know, she's been sent in by Scottish Government, you know, so.
Maureen, I think,
yeah.
Sorry.
I was going to ask you, Gordon, is that I think I don't really want to get into the work of the oversight group here because that's a separate issue. It's important and it's allied, but really what I want to look at is I think we want to action this through the interim chief officer, who I understand will be appointed very, very shortly, to take this work forward, particularly around about the rapid review of the SLWG. And I think we can action that point.
Yeah, well, I mean, I think Callum and Maureen are both saying the same thing. And I think, this is now something that we are clear is my responsibility for again. And that I would, like to be staying for more than 6 days to see it through. Unfortunately, I won't be able to make any great progress given it's something that's been around for 4 years. But Callum, I don't think it is contingent in any way, shape or form with the review of the integration scheme. The review of the integration scheme will say Perth and Kinross are responsible for strategic planning. The job description says the chief officer is the lead. I think we can crack on with it. And I think, Maureen, that responds to your point. The Independent Assurance and Oversight Group will be very interested in what work is being advanced in Tayside, both in response to Dr. Strang's report, but in order to ensure that services are safe, sustainable and delivering the best outcomes. So they may be here, they may have gone, but the commitment that needs to be given to ensuring that this work is advanced and follows due process and is reporting to appropriate governance bodies and is able to give effect to any shift in the balance of care or resources that may need to be achieved. It is critical and needs to be a matter of priority. But, Councillor Purvis will recall, other members of the IGB will also recall, although newer members won't be aware of this, that when that responsibility previously sat in Perth and Kinross, there was a associate director, Arlene Wood, and there was a programme manager and a finance manager, Lynn Hamilton, and it was difficult then. So I think we just need to be thoughtful about what realistically can an interim chief officer deliver, and how can that person be supported to achieve what the IGB's ambition is.
Okay, I'm going to finish this issue here. I think we've had quite a sufficient update from the Chief Officer on this. There are still questions outstanding, as we've clearly heard. And obviously, I will speak to Gordon as to how we deal with this going forward in practical terms. So I'll speak to you sometime in the next 6 days, Gordon. So thank you for that. And thanks very much indeed for board members' contributions to this particular issue. And although it came up as an action point, this is a major issue for us in the IJB. So I'm grateful for that. I'm now going to move on, and I would like to item 5 is matters arising. Are there any matters arising that people have that are not on today's agenda? No. In that case, I'd like to move to item 6, the membership update.
Sorry, Bob, I did have my hand up actually.
I'm sorry, Pat, it's not coming through here.
Okay.
Pat, do you want to say something?
I do think it would be important, not necessarily at this meeting, but at subsequent meetings, to give IJB members an update on the arrangements for the breast oncology service. I think that would be quite an important issue for discussion.
So we would need to find the relevant officer to talk about that. Would that be Peter Stonehouse?
Stonebridge, it might be, or it might be the Director of Acute Services. I'm not sure who is technically responsible for it. I just think it might be, rather than just reading stuff in the press, I think it would be important for IJB members to get a more in-depth understanding of the challenges, but also the efforts and the arrangements that have been put in place. And the other thing that I was going to raise was and it's not on this agenda, is the issue of capital investment in primary care premises. I think we need to start to have some of these things as standing items on the agenda. And I think the investment in health and social care hubs or health and social care premises across Perth and Kinross is becoming quite a pressing issue. And I think we need to have some input around all of that. Just my thoughts, Bob.
Thank you very much. Maureen, I'm keen to move on now, unless it's really different point.
Yeah, I just wanted to comment on the fact that there is no radiotherapy at all in Tayside, and I know someone who has had to go up to Aberdeen for their treatment. I might have been one of them, but I found out 2 weeks ago that I'm cancer free now, so I didn't have to go. But I have a couple of friends that are in the same boat, and they're going to have to go well out with Tayside, i.e. Aberdeen, Glasgow or Edinburgh, to get radiotherapy. And because the radiotherapist the radiographer has retired and there's no replacement. Now they're also putting up, giving them accommodation when they're there, and they're having someone with them. They can have a carer with them who will also be put up in accommodation for the duration of the radiotherapy treatments. And what is that costing NHS Tayside? Are they actually picking up the bill, or is it sourced by the Scottish Government?
I understand the instant answer is that they're picking up the bill in NHS Tayside for that, but actually the best person to speak about this and to pick up on Pat's point that we covered under the breast oncology issue is to have at our next meeting an update on this matter from Professor Stonebridge, who's the lead officer involved. The other issue around about capital investment, I certainly would be useful to I don't know whether we'd hold it in every meeting, but I'd certainly like to have an update on it for our next meeting as well. So could take both of these away as action points, please. Another thing, Maureen, I'm really pleased that you're free of illness. Really pleased indeed. Thank
so
you.
Am I. So worrying time. Yeah.
Yes.
Chair, could I?
Right, I'd like to move to item 6, membership update. I'm sorry we've got some technical glitches at the moment. I'm not necessarily picking up everything here in terms of people with their hands up. Scott, you're going to update us on membership. Could you also just update us on PERDA and also on the requirements for that? And could you update us on potential moving back to High Street in Perth for meetings?
Yeah, Chair, I'm happy to do so. I think Gordon may have wanted just to come in and make a comment there at the end of that last item. I'm
sorry, Gordon, please.
Yeah, no, I appreciate the interest in the breast oncology. I know that Sandra Auld and Ian McCartney Ian raised that when I last met with them, and I know it was raised at the last IGB. I think it's important that you've identified, Chair, that that's a NHS Tayside board operational manager, and that it's not, unfortunately, or fortunately, depending how you look at it, a matter that falls to the IGB. That in no way, should deny people's keen interest in this issue. So that's something that we can look to pursue. In relation to GP capital investment in GP practices, I think many IGB members were very, very impressed by the extensive work that Hamish Dougal's done in relation to GP sustainability. And I know that, Pat, I don't think you were able to join us. We had a very good development session about that 3 or 4 weeks ago. GP sustainability in terms of the workforce is one element of that. GP practice sustainability is another. And that is effectively being developed as a strategy in relation to the work within Perth and Kinross, that we would then be looking to engage with strategic partners to say, well, what are the solutions that can be brought in relation to the workforce challenges and in relation to the premises issues that under the terms of the GMS contract will come to fall to NHS Tayside, and how are you going to give effect to that, and what are the opportunities for supporting that? So I think these are really important issues moving forward, and I welcome the opportunity for us to be involved in those discussions. Thanks, Chair.
And thank you. And I note Mrs. Kilpatrick's comment on NHS Glasgow investment level there. Thank you very much indeed, Gordon. I suppose a bit about breast oncology is the issue about support in the community for individuals as well as the direct treatment options. I suppose that's why it would certainly be of interest here. So I'd like to move on to, yes, back to membership update, please. Scott.
Thanks, Chair. Just to pick up on your other 2 points about both the pre-election period and meeting arrangements. For all public sector organisations, particularly local authorities, but also health boards and health and social care partnerships, the pre-election period for the council elections is expected to be approximately around the 14th of March. And I'll write out to all board members to inform them. And the rules around that will just be in terms of business that's brought to the board within that period. But we'll certainly alert members to that in advance, and we'll provide them with any guidance in relation to that. In terms of where we're at now, in terms of virtual meetings or physical meetings taking place, certainly we're at the stage now where, in terms of with my other hat on with Perth and Kinross Council, we're starting to look at trialling hybrid meetings, which would be a combination of meetings taking place in our council chambers, as well as the option of members to join virtually. So I think once we've concluded that, then I think we could also, if the IGB meetings were to continue to take place in the council chambers in Perth, then we'd be happy to get that set up as soon as possible, so that we could have the option for members to either be back in the meeting room physically or to still have the option of joining virtually. So we'll look to take that forward as soon as possible. In terms of a membership update, a few points just for members to note and for the board to agree. Mrs. Pat Kilpatrick will no longer be a voting representative from the NHS Tayside board on the IGB from the 1st of April. I understand that the board will look to make a substantive appointment in due course. However, Donald McPherson will continue to act as a proxy member for the board during any period. We also have Bernie Campbell, who, as members will know, is a carer representative on the IGB. Her term of appointment expired at the end of last year, and in line with the initial term of appointment, there was the opportunity for her to be reappointed for a further 3 years. We've spoken with Bernie and she's happy to continue, so the IGB are just asked to formally agree her reappointment for a further 3 years. Similarly, in a similar situation, Stuart Hope, as the Perth and Kinross Council staff representative, his initial appointment was due to end at the end of March this year, and again Stuart is happy to be reappointed for a further 3 years, so the board are asked to endorse that appointment. Finally, expressions of interest were sought for the vacancy for a non-voting member on the Audit and Performance Committee of the IGB. Sandy Watts, who's the Third Sector Forum on the IGB, was happy to put her name forward, and following discussions between Sandy and the chair of the committee, the IGB are just asked to formally approve this appointment to the non-voting membership. Happy to take any questions.
Okay, I think we could probably just move to a note. Pat Kilpatrick's moving at the end of March, and she's not going very far. She's going to chair IJB in Dundee. So good luck, Pat, and we'll be working hard to get a replacement for you as quickly as possible. And I just want to thank you personally for all the contributions you've made, and you've left us with, I noticed, a few action points in today's meeting for us to consider before you go. Thank you very much indeed, and I'm sure that all the IJB welcome that, and I'm sure you'll be a big loss to the Audit and Performance Committee as well, but we'll fill those roles as quickly as possible. In terms of the 3 different nominations, can I just accept the verbal nominations from Scott Henry and just approve these as an entity?
Chair, can I just jump in again? Apologies, I think I've slightly confused people. I think I just need to correct myself and clarify that in relation to Bernie Campbell's appointment, the option was for a further year to be reappointed. So we would then have to to look back to elections where Bernie could stand again. So yeah, just to confirm that Bernie's appointment would be for a further year as a reappointment.
Okay, with that caveat, can we approve those nominations that Scott has just verbalised?
Agreed, Chair.
Okay, thank you very much indeed. So welcome back to a number of people as well. Thank you. What I want to do now is take a 5-minute comfort break, and then we'll come back to paper 8.1 on building management capacity and resilience. Okay, can we take a 5-minute break, please? Thank you. Okay, then I'm ready to restart. Thank you very much indeed. Maureen, in answer to your question, the meeting will finish when we've got through the papers, basically. I want to leave time to say something to Gordon as well. So I'm sorry about that, but we did give some parts of the agenda a bigger hearing than they might normally have done. Okay, thank you very much indeed. Let's now go on to building management capacity and resilience. And could we be brief on the introduction to this because of time?
Thank you, Chair. Yeah, I'll take this paper and I will endeavour to be brief, because I hope that despite the report arriving perhaps slightly late, and apologies for that, I hope members have had the opportunity to read this report. In it, I've sought to highlight the capacity challenges that the Health and Social Care Partnership has experienced over the years. Those were highlighted in a highly critical joint inspection report 2.5 years ago, and members will be aware have been highlighted also in audit reports and in the Strategic Risk Register. The report also outlines the challenges that we have experienced within the Health and Social Care Partnership, trying to advance a major restructure of the partnership during the pandemic. And those challenges led to a decision that, because of the delays and risks and the various interim short-term arrangements that were being put in place, that wholesale restructure was probably not appropriate, and that instead we should look to build capacity more incrementally in those areas where it's required, as identified by the heads of service and ultimately endorsed by the executive management team. So that's what we sought to do through the end of last year, and that was an approach that I highlighted to the Audit and Performance Committee that we were intending to take because of those extant audit recommendations around addressing capacity challenges. However, in the report, I've also highlighted how the demands we're facing as a Health and Social Care Partnership have increased at section 3.5. And finally, at section 4, I have outlined the areas in which we are proposing to enhance capacity, both by consolidating some long-standing temporary posts and making them permanent, and by bringing in some new posts, as outlined particularly in section 4.5. Through use of our core funding, through disinvestment, through managing vacancies, through the additional funding that the IGB secured from statutory partners for this purpose last year, and the additional funding provided by the Scottish Government, we will be able to meet these additional costs within budget. And we're really just seeking approval of the IGB to progress the process in collaboration with statutory partners to create the conditions where we have greater resilience and capacity within the partnership that will enable it to function more effectively, that will enable it to carry out its duties and responsibilities in relation to strategic planning, in relation to commissioning, in relation to operational delivery, and particularly in relation to the strategic delivery plans that we're reflecting, that we've developed, but also recognising there are a number of Scottish Government initiatives that are aligned to our strategic ambitions that we are supportive of, things like discharge without delay, hospital at home, and significant additional work in relation to social care and care homes, care at home, and interim care home placements. So I'll stop there, Chair, and I'm happy to take any questions. Thank you for the opportunity to bring this paper forward.
And thank you. And the paper is very clear, I think. Questions, please. Pat Kilpatrick.
Not really a question, Chair, but I just wanted to say I very much welcome this paper, and I know it's been a long time coming to get to the point where we can build that capacity in the IJB. So really just to say to Gordon, you know, well done, and I hope that it's agreed. I think you do need to bolster the capacity in the senior leadership team. So that was the only comment, Chair.
Many thanks.
Thanks very much. Are there any further questions? If you wish to ask a question, put it in the meeting chat if you can. I'm not seeing anything at the moment. There's a question coming in. I can't see who it's from. JP, right. Please proceed. Jackie, I've got you now.
Yeah, thanks, Chair. But I suppose it's really a question, which is also a comment, and I agree with Pat's sentiments that it's really good to see this additional capacity coming in. But it's that balance between continuing to manage the additional demands and the operational aspects of the work to address the impact of COVID, and at the same time taking forward the transformational change that you're trying to achieve. So it's really a question about ensuring that capacity is in the right place. So and I'm saying that from experience around ensuring that any transformational changes is led by professional managers and not sitting, and not just project managers that are sitting elsewhere, that actually the capacity enables them and frees them up to do that. Because some of the most successful pieces of transformation that we've achieved elsewhere has built on that foundation. Because if you create the structure outside it, what you get is a governance and project management arrangement around it, and it doesn't free the managers and staff up to make the cultural and transformational and workforce changes that they need to make. So it's really just to make sure that have you got that in the right place to enable you to achieve that.
Gordon?
Yeah, so I mean, I hope so, Jackie. We've sort of co-produced this, if you like, as an executive management team, having people bring forward proposals from their own service area that we've reviewed within our executive management team. And whilst this is around management capacity, you know, we've also got proposals around something like 200 additional frontline service posts, which will also provide additional capacity and support us moving forward. We have, I think, got a balance between providing operational management, or proposing to provide operational management capacity to our colleagues in health and in adult social work, social care. But I think we've also appropriately looking to invest in our corporate services function, which for me is very important as the engine room for driving a lot of the change and transformation, the governance, the audit, the performance, the planning activity. So I hope we've got that right. I think we've got that balance right, and I acknowledge your comments. And certainly moving forward, there'll be opportunities for us to look at whether we've got that just as it should be. But what I was going to say is the operational managers who come into play at a senior level will, as a result of that increased capacity, be able to do the operational firefight and respond to the pandemic, but take leadership in relation to some of the transformation programmes and some of the initiatives that we need to advance, because those will require that professional leadership, whether it's about interim care home beds or care at home resilience or hospital at home. Those will all be professionally and clinically supported and led. Thanks.
Thank you. Beth Hamilton.
Yeah, I'm happy to see the paper coming, Gordon, particularly in light of some of the real challenges that your support team have had. The only things that's slightly concerning me, and I suppose it's just around the fact that, you know, you're leaving, somebody's coming in, and we're making some commitments in advance of somebody coming in with new thoughts. And the only other thing I would say, I was slightly disappointed that it's so laid out as health posts, adult social work and social care and corporate services. I would have hoped that we could have looked a bit more around integration of some of those health and social care areas. I think I picked up from Maureen, there's still a kind of sense of, you know, well, that's the health but aren't doing well, the nuke's really social work, or it's the third sector. And I think it's really important that we start to send out these messages. It's not about what organisation deliver. It's about our community and how we deliver for our community needs. So that's, I mean, that's maybe small fodder, but it's just something that I just want to highlight. I think going forward, we need to look a bit more about how we integrate rather than have all these disparate sections. But I welcome and support the increase in staff. It's just how we take that forward.
Yeah, so your point's well made, and absolutely that was our intention when we were looking at the wholesale restructure of the Health and Social Care Partnership. That was potentially quite an ambitious programme that was really trying to address what you're describing in relation to integration. However, the challenges around that in the context of the pandemic and managing that through organisational change policies presented us with a difficulty and a delay. And as soon as we had intimated that we were going to restructure, we were only thereafter able to fill posts on a temporary basis. So we've got these large numbers of posts, and we felt that has introduced a degree of fragility, that has introduced a degree of risk. We were concerned that if we started with EMT and restructured at that level, then it would be 6 months, 9 months before we were looking at heads of service or looking at service managers, 6 months, 9 months. And we would start to move into the territory where we were beginning to face up to the proposition of a national care service, Beth. We felt we couldn't wait that long because of the risks. We felt we had identified where the needs were. And as it happened, the additional funding from the Scottish Government means that we're not articulating this as budget requisitions to statutory partners. We are looking at this being funded from within existing budgets. That said, the structures matter less than the culture and the behaviours and the commitment that people have to working together. So we do have lots of initiatives where teams are co-located, teams are integrated, teams are working in a way where we're improving access, reducing duplication. So this needn't preclude us from looking to adopt a more integrated way of working or the most effective model for delivery moving forward. But it was really just felt that, particularly with my departure, it was important that the need to build that additional capacity, designed by members of the executive management team, so the heads of service, and getting it in the right place at the right level, which will take through an HR process with the statutory partners in order to get there, was an imperative at this critical time in the partnership's journey.
Okay, I accept that, and I'm slightly reassured by what you've said, Gordon. I support the need to move forward, but I also felt I need to say about, you know, the culture moving forward for the integrated agenda. But yeah, I would support the paper.
Thank you.
Thanks very much indeed. And I'm going to bring in Maureen Summers, and then I'm going to move to recommendation. Maureen.
Yeah, well, I just want to make a couple of comments to members of the board and that before I go. I have to go now. I've got a family commitment and I have to go. I thought we would be finished by now. But to say thank you very much to Pat Kilpatrick. I didn't realise that you were going, Pat. Perth's loss will be Dundee's gain, I'm afraid, again. You know, we always seem to be losing to Dundee, and really sorry that you're going, Pat, and thank you for your support, especially to the public partners and that, you know, all the past meetings. And again, Gordon, going to miss you, Gordon, because you've been more available than any other chief officer that I've, you know, had to work with in the past and that, like, you know. You've always been there if I want you, and even setting up a phone call and things like that, which is maybe what it should be like. But I just hope that your successor, you know, is going to make himself available to and will be as supportive as you have been to ourselves as public partners. So, and I wish you every success in your new job. It'll be a complete change for you, but wish you well, and same for you, Pat. So.
Thank you, Maureen, and I'm not going to ask Gordon to respond to that. I'm sure he will, but he may be doing quite a lot of that today. There's a lot of hears. Thank you very much, Maureen, and I'm sorry you have to leave us. Yeah. Gordon, can we now move to the recommendations, please? And I think I recall from the discussion I had with you earlier is that we don't formally have to approve this additional management capacity, but I think you were seeking endorsement. Is that correct?
So, I mean, it would be useful were the IGB to be minded to approve the funding in order for us then to take the actions forward in our discussions with statutory partners about how we deliver on this as described in the paper. So, yes, for that reason, if the IGB, I mean, I think approval endorsement, I'm never entirely sure what way we want to go with this, but I think, you know, I'm very pleased that IGB members have been supportive of what this is proposing, and that's maybe just what we need to take this to the next stage, Bob.
And the reason why I raised the point was that at what level do we have to approve these more operational appointments, and that was simply that point, given that the budgets had already been agreed for this. That was all. But I'm not going to play around with words on this, I think, but I'm always cautious about use of words when it comes to recommendations about approvals, whether they're formal or endorsing, which is a term we often use to support the measures without formally having the power to approve things. And it's that part there that I was less clear about.
Okay, so I suppose from my perspective, this is, you know, if the IGB is being asked to invest £500,000 into the partnership's management capacity, then we would be looking for that approval.
Okay, that's clear then. Thank you. Can we approve the additional resources on these posts?
Agreed.
Okay, I'm not hearing anything else. So can we therefore accept the recommendations, and we look forward to getting these posts in place as quickly as possible, Gordon, because there are consequences of these roles not being filled. And, you know, in another time I'll have to have a longer conversation about the impact of not filling roles. And it's not just about moving people around. So we need to get these posts in as quickly as possible. Thank you. Right, let's now move on to 8.2, Autism Learning Disability Strategic Delivery Plan.
Yes, so Kenny Ogilvie is going to present on this paper and has a short PowerPoint presentation just to capture the salient issues. And I think, Kenny, you'll be encouraged to be brief and swift, if that's okay.
Thank you.
I'll indeed, Gordon, thank you. This is the Autism and Learning Disability Strategic Delivery Plan for 2022 to 25. Can you move to the next slide, please? And just here we have definitions of autism and learning disability. Important to note that both can have significant impact on a person's life and the lives of their families, and people can have one or the other or both. Next slide, please. For nearly 3 decades, the strategic direction for health and social care in Scotland has been to support people with autism and or a learning disability to remain in their own homes rather than institutional care. And more recently, greater emphasis has been placed on increasing choice in the types of support available and supporting the individual to have more control, improving access to employment and education, and being able to actively participate in communities. Key documents supporting this are the Scottish Strategy for Autism, the Keys to Life Strategy, and the Coming Home Report. Historically, services have often failed to be available early enough to provide the right support to maximise a person's independence. They were often inflexible and not designed to meet the individual's needs. And for people with more complex needs, services have frequently failed to identify and address underlying causes of behavioural issues, and instead it provided large amounts of social care to try and manage behaviours that services found challenging. This often did not support the person to achieve their desired outcomes and did not provide best value financially. Life expectancy for people with a learning disability has increased in recent years, although it should be noticed it is still 14 years shorter than the general population. And people with a learning disability are more likely to have at least one comorbidity than the general population. There's also been an increase in numbers of children born with profound and multiple learning disabilities surviving into adulthood. Both of these developments are to be welcomed. However, together with increasing numbers of people being diagnosed with autism, this is probably due to improved access to diagnosis rather than increased prevalence, and older parents no longer being able to care for their adult children, there is increased pressure on services. And again, a couple of examples of this increase in demand are shown in the slide. In the past 10 years, the number of clients with a learning disability has nearly doubled. In the past 20 years, the number of children diagnosed with autism has nearly tripled. If we go to the next slide, please. There are currently over 250 people with complex needs being supported in Perth and Kinross. The total annual cost is just over £23 million. And every year, over £1 million needs to be added to existing budgets to meet the increasing demand for care packages. And the main reasons for this are young people transitioning into adulthood and increases in existing packages due to carer breakdown or a deterioration in the person's condition. Approximately 100 people a year with autism and/or a learning disability are supported each year to move into adulthood, and roughly 1 in 5 of these young people has complex needs. And the numbers of young people with complex needs is increasing significantly year on year. In 2012, 10 young people with complex needs required support to transition, and in 2021, this number had risen to 24. In Perth and Kinross, there is a specialist learning disability health team which provides support with diagnosis, specialist health interventions, positive behavioural support and independent living skills. There's currently no specialist social work support for people with a learning disability other than the transitions team, which supports people with complex needs as they move into adulthood. There is currently no specialist statutory service for people with autism based in Perth and Kinross. There is a specialist team which has a Tayside-wide remit, but resources are limited and there's often a long waiting time to access support from it. Get the next slide, please. So in order to meet increasing demand and provide high quality effective support for people with autism and/or a learning disability and meet the objectives of the Strategic Commissioning Plan, Perth and Kinross Health and Social Care Partnership will work with clients, carers, partner organisations and other key stakeholders to support people to live independently in the community, try and ensure people have equal access to all aspects of society, and ensure people have access to high quality and personalised support when they require it, and transform support for people with autism and/or a learning disability who have got complex needs. Now in Perth and Kinross, we've got an autism strategy group and a Keys to Life strategy group, which are responsible for the local implementation of the national strategies. And both groups include client and carer reps who either sit directly on the group or feed in via partner organisations. Clients and families are frequently directly involved in the commissioning process for services. A charter of involvement is being implemented for people with a learning disability, and organisations locally who provide support will be expected to sign up to the charter, and this will help ensure people with a learning disability are fully involved in any future service developments. Perth and Kinross also has representatives at the Assembly, and this is a national group of people with autism and/or a learning disability who meet regularly to discuss relevant policies and developments and feedback directly to the Scottish Government. The strategy groups work closely with other strategy groups such as the Carer Strategy Group, Mental Health Strategy Group and the Digital and Tech Strategy Groups. And this helps improve support for carers across Perth and Kinross, improve access to support with mental health issues and ensure access to the latest digital and tech developments. An example of this is Brain in Hand, which is a mobile app designed to support a person's mental health by prompting them to use bespoke coping strategies. And currently 20 licenses are available in Perth and Kinross. I think roughly half of them are actually currently being used by people with autism, and we're in the process of procuring more due to the high level of uptake. And services supports are provided by a range of organisations from the statutory, independent and third sectors, all working collaboratively. You can get the next slide, please. Over the past decade, there has been significant progress in shifting the balance of care away from institutional settings and implementing personalised support for people. And this includes development of small group living units across Perth and Kinross, personalised care packages utilising self-directed support options, Day services have been transformed into day opportunities, which provide access to a range of community-based learning and leisure activities. Improve access to health services, and that's generic services, and also the development of bespoke services. A range of services and supports available to support people with autism and their carers. Specialist services run by third sector organisations, such as the One Stop Shop, which supports people with autism, and also making sure information is available in easy read form. Get the next slide, please. These developments listed above have helped people with autism and or a learning disability lead more independent lives. And for example, in Perth and Kinross, over the past 10 years, there's been an 83% reduction in the number of people with autism and or a learning disability in residential care. In the same time period, there's been a 10% increase in the number of people living in supported accommodation. And there's also been a 21% increase in people with autism and or a learning disability accessing packages of care through option 1 self-directed support since it was implemented in 2014. And whilst this shift in the balance of care has improved outcomes and quality of life for people, community-based packages on average are more expensive than care home placements. So this has added to pressure on financial budgets. We can go to the next slide, please. And here we have the key areas of investment over the next 3 years. They are support for young people transitioning into adulthood, funding to meet increased demand relating to current clients, and funding for the Complex Care Transformation Programme. And this includes a range of frontline posts, including psychology posts, outreach workers, overnight responders, specialist social worker and occupational therapy posts, and positive behavioural support training. Now, whilst the impact of the Complex Care Transformation Programme is likely to reduce the amount of extra funding required annually for social care, there is still expected to be a shortfall of 2.9 million over the next 3 years. The 2022-23 draft budget proposes that higher than expected Scottish Government funding is used to balance the position in year 1. So this will reduce the £2.9 million deficit to 1.3 million over the next 3 years. And further discussions will be required with partners regarding future funding. Also, capital investment will be required to deliver the Complex Care Transformation Programme, and a strategic outline business case for capital investment in a flagship core and cluster development has been assessed and approved by the PKC Strategic Investment Board. This will be further assessed by the subgroup before final approval is sought at the PKC Strategic Policies and Resources Committee. We could get the next slide, please. And just finally, over the next 3 years, the Autism and Key Life Strategy Groups will continue to improve services and supports for people with autism and or a learning disability. And as stated above, a key area for development is improving support for people with autism and a learning disability who have complex needs. And to address this, the Complex Care Transformation Programme has been initiated. And there's 6 work streams to this programme. First is the formation of an integrated multidisciplinary team called SCOPE, and this will consist of a range of professions including psychology, social work, occupational therapy, physiotherapy, speech and language therapy, community learning disability nurses and support workers. We're also looking at developing an overnight responder service. We're reviewing our day opportunities and respite to ensure they are appropriate for people with complex needs. Also reviewing and improving our transitions processes for young people moving into adulthood, implementing a comprehensive and consistent model of positive behavioural support across all services, and developing core and cluster models of support and accommodation across Perth and Kinross. A performance framework has been developed to measure the impact of these actions, the aim of which is to improve the quality of life of people with autism and or a learning disability in Perth and Kinross, help them maximise their health and independence, improve access to employment and further education, and be actively and participate in their communities. And they will also enable people in long-stay hospitals to be discharged and live in the community, and also for people placed outside of Perth and Kinross who wish to return to move back. And I'm happy to take any questions on that.
Well, thank you very much indeed. That was a very comprehensive input into which is a very big issue. And thank you very much for that. And I know that you tried to be as brief as possible. It's very difficult, isn't it? Yeah, thank you. I'd like to invite questions, please. Is that Sandra Auld first and then, or is it Beth Hamilton first, Sandra Auld and then Donald McPherson? Beth.
Kenny, congratulations. I really like the way it's been laid out, etc. The only slight concern I had was I would have rather seen human rights up there at the beginning, the middle, the end and right through it, because I think sometimes people forget the whole ethos around supporting people with learning disabilities about the equalities and human rights. And I know that the ethos is there right through it, but there's something for me about, can we put in some there about people having the same human rights as everybody else, and this whole document is to try and support that development. It may be too late at this point, but even for future, for going forward, I think it's really key, you know, about equalities, and these people that the strategy is written for have the same human rights as the rest of society. So it's not what we're doing for them, it's what they're entitled to. So I hope that's not an inappropriate comment on the document, but I think it's really important that we put that up there.
No, I totally agree with you. And the National Learning Disability Strategy, same as you, which preceded the Keys to Life strategy, was very much human rights based and focused on that. And yeah, apologies, like I say, this was a fairly brief summary, that there was a bit of a whirlwind. But yeah, certainly the emphasis on human rights is certainly in the strategy groups that are working locally. And apologies if that didn't come across as fully as it might in the presentation.
Yeah, but the contents and the work that's ongoing is really impressive. I appreciate it. So thank you.
Thank you, Sandra Auld, and then Donald, and then I'll take Jackie and then Sandy.
Okay. Thank you very much, Chair, and thank you very much, Kenny, for your very helpful presentation. We discussed the paper and the strategy at the reference group last week, and I've got from that we've had some fairly comprehensive questions and comments, which I think in taking into account the kind of time constraints, what I might do is copy and paste them into the chat, and that'll mean that members can see the questions and the comments. But if you would be good enough to come back to me in due course and respond to some of the questions, if that's okay.
Yes, certainly.
Best way to proceed.
Yeah, certainly. If I can take them off the chat, or if you can send them to me independently, leave it with me, and we'll get back to all the questions that you have.
Yeah, thank you. And I guess just the only one comment that I would make at this stage is, so I know we've been reminded on many occasions before that the IJB doesn't have a responsibility for CAMHS, but the sort of inextricable linkage between the CAMHS service and in particular autism, I just find it really strange that I couldn't find any mention at all in the documents of the CAMHS service at all, and I just found it quite strange.
Kenny?
Yeah, like I say, this document is focused primarily on support for adults, and obviously CAMHS by definition is young people. And I do know there is significant investment going nationally at the moment into CAMHS to try and improve the service provided and reduce waiting lists. So yes, hopefully access will improve significantly in the coming months, stroke years. What I can say is we have certainly recognise the importance of accessing mental health supports, appropriate mental health supports, especially for people with autism. And we have representatives now from the community mental health teams on the Autism Strategy Group. And as a result of that, the community mental health teams are now accessing specialist autism training from one of our local third sector organisations, so they can improve the quality of support that they are providing to adults in Perth and Kinross. And also, as I mentioned a couple of times, we've got psychology posts as part of our new scope team, and that'll be a qualified psychologist and a psychologist assistant, which again will improve greatly access to psychology support and positive behavioural support for people in Perth and Kinross.
Okay.
Okay, and thank you. And Kenny, when you come to respond to Sandra's questions, could you make a point of circulating that around the board members, please?
Yes, certainly.
Thank you very much. That takes me to Donald McPherson.
Yeah, thanks very much. Good afternoon, Kenny, and thank you for a really helpful and clear report. I had 2 points or questions around it. The first one was around the performance framework, and I found that really good. I mean, sometimes it's not clear what the outcomes are that people are trying to achieve, and I thought it was very good the way that you've got the outcomes, you've got KPIs linked, and you've linked them to the national outcomes. So really welcome that. My question in relation to that was just how are the targets, the specific targets, going to be set, and also how are they going to be incremental over time, because they should be aspirational and they should pull the service forward. So that's my first question. And my second question was just around in the transformation programme, one of the work streams, the work stream 2, is about shifting from paid carer overnight to an overnight responder service. And I can see the rationale for doing that, but I suppose my question was, how is that likely to be received by service users and their families? Will they see that as a diminution of service?
Firstly, thank you for your comments on the performance framework, and I will feed back to the colleagues that supported the development of that. I suppose it's important to say the performance framework will be an evolving process as well. This is a snapshot in time, and we are in the process of carrying out benchmarking work with other comparator areas that will help us set targets, and we'll monitor our performance as we proceed, like I say, certainly with the comparator partnership areas. In terms of the responder service, I mean, again, what we have at the moment is that we have lots of people receiving one-to-one overnight support from paid carers, and that does create quite an artificial environment. Obviously, it isn't standard for the population to have a paid carer in the house with them overnight. And there are people out there who have expressed a wish to move to using technology-enabled care and having a team of carers nearby to respond to them as required, rather than necessarily being in their accommodation all the time. That said, the responder service won't be suitable for everybody's needs. There will still be people who will require one-to-one overnight support, and those people that still require it will continue to get it. So it's not an either or. This is an additional service and support that will be used where it's appropriate and dependent on the necessary risk assessments being carried out on each individual.
Okay, thanks, Kenny. I think that point about not trying to drive people from one to another is key to that, and also great to hear that you'll be benchmarking the KPIs with other groups. Good, thank you.
Welcome.
Okay, that takes me to the next person. Hold on a moment. I can't seem to get my. I think I'd indicated other names. Who was the person after Donald? I think there was Sandy, and there was someone else, and I can't see them there at the moment. Can we take Sandy then? Thank you.
Thank you, Chair. The third sector was discussed this strategy yesterday at our forum meeting, and on the whole we're extremely supportive of it and very welcoming of what's included in it. We noted that the strategy links to the Scottish strategy for autism, but we were also discussing other neurodiverse conditions, and in particular ADHD, which I believe is more numerous in Perth and Kinross than autism, including, of course, people who have both autism and ADHD. So we wanted to ask if there is any opportunity for the strategy to be strengthened to show a more inclusive reflection of neurodiversity rather than just the autism focus.
Yes is the short answer to that. I mean, the autism focus is there because there is a very specific national autism strategy, which obviously we were provided funding for in previous years to implement on a local basis. And as you rightly say, the national focus was on autism, and a number of people with autism have ADHD as well. And ADHD does exist in the wider population, so yes, we could look at reflecting that.
Okay, Sandy, are you content with that?
Absolutely, yes. Thank you very much, Kenny. Thank you, Chair.
Thank you. Then Jackie Pepper.
Thank you very much, Chair. I was going to make a point about, can you hear me all right? Because sometimes
you're quite faint at the moment, Jackie. If you could maybe increase your volume.
Yeah, it's my laptop. I think it's on its last legs.
Okay.
It was Beth's point about human rights and having that right up front, and I think there's also something about ensuring that this is about making sure we have inclusive communities that wrap around all its residents, if you like, so that whatever developments we're taking forward from whatever aspect of community development, not just through the Health and Social Care Partnership and the IJB, but at a community planning level, is designed in a way that they are inclusive and supportive of a whole range of needs, because that's the only way that you can actually ensure that people take part in a wide range of supportive and meaningful activities, and that well-being is enhanced. So it's that relationship to community planning that I think is key. So I do wonder whether this is something that needs to be highlighted at a meeting of the Community Planning Partnership in due course. But I was also wanting to make a comment about the importance of having a consistent approach to self-directed support and support for families right through the lifespan. And I think some of the changes and the strategies that we're taking forward across children's services and their linkage into this work is also encouraging to see, because I know that we've got, for example, some of the practices that we're putting into place in terms of young people and something called family group decision making. So it's really empowering families to make decisions about support packages for their children and young people across the whole spectrum of need, and further work at our residential respite unit at Woodley Cottage to spend more time in outreach work rather than inreach in the residential unit. So, and I know that's all linked into this work that you're doing, Kenny, but it was really just to emphasise that linkage across the whole age spectrum, that and to assist that transition from you know, from child to adulthood, and that's as easy as possible for both the individuals concerned, but also their families.
Okay, Kenny.
Yeah, thanks, Jackie. No, I totally agree with that. I think obviously we do work currently. We work closely with the community planning partnerships. I think we need to strengthen those links. There's a whole range of health and social care partnership responsibilities that would benefit from enhanced working with the planning partnerships, from the work we're talking about here to substance use, etc., etc. Just on the family group decision makers, we have got funding for 2 family group decision maker posts as part of our scope team. And just to go back to the previous comment as well, regarding attention deficit disorder, you know, again, we try not to get too hung up on diagnoses, etc. And certainly the scope team will be a centre of excellence stroke knowledge that will support more generic services as well, that support people with a range of conditions and requirements and reasons for referrals into those teams.
Okay, thank you very much. I greatly Kenny, I believe that you're our direct involved person with the community planning partnership. It would be useful at some stage if we can maybe consider how we can best maximise our involvement with community planning partnership, but that's for another day. I'd like to move now to the recommendations. And we approve the Autism and Learning Disability Strategic Delivery Plan, notes progress to date, and requests an update in 12 months' time. Are we content with that? Thank you. And I note Sandra Ald's chat comment as well. Thank you. Let's now move on to, thank you very much indeed, Kenny. That was quite a big topic there, dealt with, you know, within a relatively short period of time, issues that this need to have quite a lot of time spent on them. Thank you very much indeed. That's been really helpful, and it feels very positive to me, certainly from where I was working on this 30 years ago. Right. So we now move on to update on Pitlochry Community Hospital inpatient unit. Gordon.
Yeah, no, I'm just going to introduce Evelyn Devine's going to speak to this, our Head of Health. It was felt appropriate to bring this paper, I think, at your request, Chair, in view of the fact the decision that we had to take over Christmas and New Year around the temporary closure of the inpatient unit. So this report, well, I won't tell you what this report says. Evelyn's about to tell you that. Thank you, Evelyn.
Thank you, Gordon and Chair. Yes, the purpose of the report is to inform the IGB on the need for an interim closure of Pitlochry Community Hospital inpatient unit. For those that are not so aware of the unit, it is an inpatient 9-bedded facility which provides step-down care for rehabilitation for the people of Pitlochry in the main, but surrounding areas as well. In terms of the background and the lead up to the interim closure, the HSCP have had long-standing recruitment issues into rural Perthshire as far back as 2018, but this was very much exacerbated by COVID and by new maternity guidelines in relation to a very small staffing group in the first place. So any sort of vacancy factor there impacts very quickly. So unfortunately, as a HSCP, we had to go into contingency measures in October 2021, supported by our Associate Nurse Director and HR and staff side. We did secure substantial investment to keep the unit open, which was very welcomed. And we did work to maintain a very high-end agency recruitment, as well as the use of bank staff, returning retirees. We looked at skill mix in the unit, shift patterns, considering 12-hour shifts to maintain the unit, and looking at a local accommodation for agency staff that came into the area. So, however, despite all our efforts, and I have to say enormous efforts on behalf of the HSCP and NHS Tayside management and clinical staff to maintain the unit in an open position, in an operating position, The reliance on agency staff got too heavy in relation to core staff, so it was deemed that the ward wasn't safe to maintain open at that time. So we looked at an interim closure early January, and is obviously still in that position today. So the report also covers a proposal in how we move forward. As an HSCP, we continue to actively recruit to the unit. We are looking to remodel the workforce to improve recruitment and retention, and we will do that in collaboration with key stakeholders. We are looking to work with key stakeholders and to refresh our locality needs assessment and clinical needs for the area. Again, we want to continue to support the sustainability of our GPs and have been working with our GPs more recently with our advanced nurse practitioners, supporting GPs around urgent visits, etc. So also considering new ways of working, and so looking at the future alongside. I think we've heard previously through the older people's delivery plan about the redesign of care at home, getting more local care at home into small communities, enhancing our locality integrated services, and our proposal for hospital at home across to be delivered across Perth and Kinross over the next few years, and also looking at our interim bed usage, which is a model we put into place over winter at the bequest of Scottish Government. So in summary, the report asks the IJB to acknowledge the significant workforce challenges and the efforts that have gone into place to maintain the unit in an operating position, to build on a sustainable model, because sustainable is really key here, sustainable model of recruitment and a model of care that will support Highland Perthshire in its totality. And it also acknowledges the need that this is quite a significant piece of work at a time when we're coming out of COVID, and we need to really address the programme support in and around a more proactive consultation and engagement process for Highland Perthshire as we move forward. Thank you, Chair. Happy to take questions.
Thank you very much. Councillor McDade.
Thank you very much, Chair. Thank you, Evelyn. That's a very helpful summary there of what's in the paper, and I appreciate the lengths that you've outlined that went into attempting to maintain a level of service provision in Pitlochry. Nevertheless, obviously this is quite concerning for those of us who are passionate about keeping our local community hospitals open across Perth and Kinross, and you'll be aware, and I can see Amanda's there, Amanda has shown me around probably the nooks and crannies of every community hospital in Perthshire. So I'm really passionate that we do keep this open and we find a sustainable model, and I appreciate that you are too here saying that. So you talked about it as an interim closure. Can you give us, and I appreciate this is a bit of a, how long is a piece of string in terms of recruitment, but can you give us any indication of what sort of time frame we might be looking at for that, subject to caveats, etc. And can I also get some information about if there are outpatient services still being provided out of the hospital, because certainly the last my last understanding of the position was that what had originally been the older people's ward has been moved over to a lot of outpatient services that are being delivered locally, and I would like some reassurance about that, because I think people often read in the press headlines of Pitlochry Hospital closed, etc., and in reality there were sort of almost 3 different sets of services being provided out of that, some outpatient stuff, what was the minor injuries unit, as well as the inpatient ward. So could you just sort of give us a bit of an overview as to those 2 questions around how long this time frame we're looking at, and also what services continue to be delivered out of the hospital?
Yeah, thanks very much, Councillor McDade. I'll bring Amanda in a minute around the timeline in relation to recruitment, but I think you're absolutely right. It's really important, the messaging around this, because Pitlochry Community Hospital remains a very active hospital in relation to health and social care. It provides you know, the health and social care integrated teams that work from there, the older people's mental health teams, and lots of outpatient clinics across the piece that will support the hospital. So yeah, it is still a proactive hospital in relation to everything that goes on in there. I have to say the introduction of our care and treatment services has been extremely successful in terms of securing recruitment to these roles. They've been jobs that people have been very interested to come and do. And I think the 9 to 5 element of that is probably encouraging for nurses to be able to want to support in that way. But it's definitely proving to be an area where people are really interested to work in. So I'll pass over to Amanda for the timelining around recruitment. We're obviously still actively recruiting to the hospital and hoping to get some sense of when we can open the beds. Maybe not all the beds in the first instance, but maybe some of them. Amanda.
Thanks, Evelyn. Yeah, I think just in response to the recruitment timeline, so we currently, as Evelyn said, we've got posts out to advert, and it has been an ongoing process, the recruitment for Pitlochry Community Hospital for the GP unit. So we have a post that does close on the 18th. It's unclear how many applicants we will have on that process, but we probably have about a third of the staff that we require for the 9 beds at this moment in time. We are looking to see and work with the lead nurse to see how we can open up some of the beds, as Evelyn said. So can we open up a reduced number of beds with a reduced registrant population? And we're working, as I say, with our lead nurse to make sure that that's professionally viable, you know, and safe and clinically safe to do that. So that's the piece of work we're needing to do next, and I suppose that's the permission we're asking for today, is just to go ahead and explore some of this and gain the support that we require to do that.
Sorry. Oh, sorry. Is that your question over, Sander?
Yeah, I had a further follow-up one, but I'm quite happy to let other people go first and come back later.
Oh, thank you very much. It may get covered anyway. Councillor Duff and then Pat Kilpatrick.
Thanks, Chair. Obviously this is a community hospital that covers an absolutely massive surrounding area. It's not just for Pitlochry, it's really for the whole of Highland Perthshire and probably beyond that. You know, in the next nearest facility, particularly for those who maybe don't have access to transport, probably in Perth, the next most accessible one. So obviously this is a real concern to residents, and you can understand when you look back in time at what happened with Aberfeldy Community Hospital and their proposals for the Dalweem, the small bedded unit in Dalweem. You know, how the local residents are concerned about the future for Pitlochry Community Hospital. I'm pleased that, you know, with the report that you've provided for us today and what's you know, looking to be done, and I hope there is a clear commitment to reopen the 9-bedded unit in understanding time. I just wanted to ask about the GP situation for medical cover for the hospital. I'm aware that, you know, there are issues with GPs in the medical practices in the area, and I just wondered you'd give us an update on that. Thank you.
Yeah, I probably don't have the most recent update in terms of the recruitment to the G. I think we have at least one post out to recruitment there from the GP practice perspective, but the GPs do cover the inpatient unit in relation to Pitlochry, and that has been ongoing for some time. We have been working more recently on a medical model which is supported by Medicine for the Elderly consultants as well. So we're looking at a sort of mixed economy model where we would have some GP cover and some MFE cover to support that, which really enhances the sustainability of the medical model and gives us a more, I suppose, more specialist input into the unit as well, Councillor Duff. So that's the model that we've tested in Crieff Community Hospital and in Blairgowrie Community Hospital, and is working very well. And because the GPs are very busy post-COVID, it's really supporting their sustainability. So we haven't introduced that to Pitlochry yet, but it's certainly something that we've been in discussion about.
Okay, so obviously, you know, some sort of GP cover is a vital part of the arrangement, presumably.
Well,
So that
yes, it's maybe not a vital part if the MFE consultants can cover it, but certainly the medical cover is a vital part of the arrangement. Yes.
Yes. No,
Yes.
no, that's fine. Thanks very much for that.
Thank you very much, John. Pat Kilpatrick, and then Sandra Auld, and then Sarah Dickey, and then I'll come to Councillor Purvis.
Yeah, thank you, Chair. Good afternoon, everyone. Thank you for your paper. I just wonder if this should have been flagged up as part of the risk assessment. I mean, we had a big paper on risk, and it was a very good paper, and it got good feedback from the committee. But you know, there isn't an awful lot of point of flagging things up as a risk unless you're in a position to take preemptive action to avoid the risk becoming a reality, if you like. And I just wonder, I don't know as an IGB member if we've known for a long time that this was on the cusp of viability, or that strategies we were employing to maintain it were struggling. You know, we were struggling with that. I just didn't have much of a sense that this was going to be, you know, get to the point where a 9-bedded unit, which is not huge, would not be viable. So that was, you know, where did it sit in the risk assessment? And are we getting a bit too comfortable with the idea of risk because we've got risk assessments and we've got scorings of risks and we've got DATIX reporting and all of that? But actually the whole point of the risk is assessing the risk is to avoid it happening. And the second point, Evelyn, is do the GPs, to what extent do they take responsibility? I suppose it's adding on to Councillor Duff's question. You know, in places I've worked in the north of England, particularly where there are a lot of community hospitals, and we were very involved with the Community Hospitals Association, because this problem is not a new problem. You get this all the time in community hospitals, and I just wonder, you know, what involvement of the GPs, what involvement of the Community Hospitals Association, other networks who've maybe dealt with this, might have dealt with it in a different way, I'm not sure. Of course, these are different times, and I appreciate there are different pressures. Are we looking at, you know, innovative ways of solving this? Our answer in Cumbria was lots of advanced nurse practitioner posts, nurse consultant posts, in medicine for the elderly, and in rehabilitation and in palliative care. And I just wonder, you know, are we looking at all of that, Evelyn, or are we just saying shut down?
That's the plan, Pat. So if I just answer your first question first, the contingency planning for MFE and Pitlochry does sit within the strategic risk register of the partnership, and it sits very firmly within the operational risks that get reported through to clinical care and professional governance. So they are sitting there in the risk register, and I think they still sit at red, actually, in both operational and strategic.
Well, I don't think it says Blair Gowrie Cottage Hospital. It says the ability to, I mean, sorry to interrupt you, but I don't think it says it's not specific. Is that, Evelyn, in the risk? Yeah. I went back to the paper the other day, and it talks about sustainability and sustainability of community and primary care services. I don't think it ever says, you know, this like a practice, you know, like when Bridge of Erne went, we didn't really have anything that said this particular practice is on the cusp of viability. And I just wonder, did we ever have anything as a board that said this service, this 9-bedded unit is on the cusp of viability?
I'm not sure from a strategic risk register specifically for Pitlochry, but it does remain as a workforce risk issue for us.
Okay.
And it's the workforce issue that's a real problem, because if we had the workforce, the unit is sustainable.
Yeah, but I mean, risks in the workforce are across the piece. They're not just in community hospitals. They're in everything that we look at the moment.
They're significantly in community hospitals, Pat.
Yeah, it's just the issue is I was surprised when I got this information, because I wasn't aware that it was just quite as on the edge, Evelyn.
Yeah. So I mean, it's something that we can take back and have a look at as part of our risk meetings.
I think it's more an issue about, are we updating the IJB? Do the IJB know this? Look, this could go either way. We might be able to resource it and we might not. It's more just a, you know, not having any surprises for board members.
Yeah, I get that. And the second question was around a sort of different type of model. Absolutely. You know, we have been building around MFE services, advanced nurse practitioners, ECS practitioners, you know, so that is what we really need to look at to sustain the model of care in Pitlochry. We need to look at a different way of working around it.
But forgive me, but we don't actually have any of these kind of posts at the moment. We're just looking at how we might use them in the future, is that right?
Well, no, we do have got significant number of advanced nurse practitioners in post. We have one up in Highland Perthshire already.
Right.
I might interject here, Pat. We've got Sarah Dickey coming on shortly. She might be able to,
Okay,
if that's okay with you.
Yeah, that's fine.
And I'll take Sandra Auld first, and then Sarah Dickey, and then Councillor Purvis.
Thank you very much, Chair. And hello, Evelyn. Thank you very much.
Sandra.
I suppose just to follow on a little bit from one of the final points Pat made around keeping the IJB updated. Again, following on from the reference group meeting on Friday, there was quite a bit of discussion around this topic and serious concerns expressed by members of the public around the lack of communication leading up to the closure and the lack of consultation as well. And while people, excuse me, very much appreciate that due to, for example, safety and, you know, staff numbers, etc., then decisions maybe have to be taken quickly. But I just wonder, so the question in there is what plans are there for engaging with the community and for reassuring them, but also back to Pat's point around keeping the IJB updated. It does become embarrassing almost at some points where the first that some members of the IJB get to hear about things are through the media and not from communication from the board. And I would like to ask if, again, moving forward, if there could be an undertaking to where possible, accepting that sometimes this isn't possible, but where possible, there can be things put in place so that the board is kept informed.
Yeah.
Thank you.
Thanks for that, Sandra. And you know, I do think, you know, we were in a very challenging time between Christmas and New Year, so we need to put that out there. We were significantly in the middle of dealing with more strains of COVID. So we were trying to balance a lot of work. That's the first thing to say in terms of where we had got to with dealing with COVID, both on the PRI site and elsewhere in our hospitals. We had hospitals closed due to COVID. So there was quite a significant challenge in the management team just to really be able to keep our heads afloat and manage everything. In the meantime, we were still trying to balance that. You know, the sort of workload in terms of, do we have enough agency staff? Do we have enough core staff? So decision was made pretty rapidly at the end of the day, over a period of sort of 48 hours, where we really realised we couldn't maintain safely. We couldn't maintain the unit. So I do take on board, you know, the onward communication or the pre-communication with IJB, etc. And that's something that we no doubt could improve. You know, I'm happy to take that on board, but there was lots of things at play over that Christmas and New Year period, leading up to the January sort of interim closure.
Yeah,
but there's no doubt in communication we can always be better.
Yeah, I think also you need to relate back also to the building management capacity. We're severely short of some of those roles. It was around engagement and communication, I'm pretty sure, was in that list. So
yes,
again,
right.
these are the kind of kind of added impacts for that. Thank you very much, Sandra. That takes me to Sarah Dickey and to Callum Purvis.
Thank you very much, Chair, and thank you, Evelyn, supported by Amanda, for the paper. It was just to offer to members of the board the appropriate nature of the escalation and involvement of myself in regard to this matter, given the fundamental issue was around being able to clinically provide a safe staffing model for a nursing workforce for the patients in the 9-bedded inpatient unit, and this was in the absence also of a lead nurse within the Health and Social Care Partnership at that time, awaiting the successful, now recruited lead nursing position. So I do want members to note the extensive engagement around nursing workforce matters, the benchmarking that was done, the tireless efforts that were made to explore every model that are known to us to try to provide a service to the population of Pitlochry through the 9-bedded unit. And I am absolutely, without doubt, convinced that the opportunity to provide whatever model is decided through the appropriate engagement of all relevant stakeholders, it's provided through this opportunity. And whether or not it returns to a 9-bedded inpatient unit or it becomes an alternative model is not for us to decide today, but the fact remains we have not got a safe staffing nursing workforce model to provide contemporary safe clinical care for patients in a 24-hour 9-bedded inpatient unit, and fundamentally that's the issue here. So we cannot open those beds at this time on that premise. Thank you.
Thanks very much, Sarah. Councillor Purvis, and then back to Councillor McDade, and then John Duff. Thank you.
Thank you, Chair. I just wanted to ask around beds. I know it's been referred to by a number of people in some of the answers, but I recall a presentation which I thought was very helpful not long after I joined the IGB from Hamish about the number of beds that we had, but also where they were in Perth and Kinross, and looking at, I think it was maybe Angus benchmarking against and some other areas too, and that perhaps we had the right number of beds but in the wrong locations. Now, I know you've been looking at sort of other solutions and other models. Can I just check, is that work still progressing and still something that we are looking for an outcome of, or has the new work that's been done around different models superseded that?
That's a very good question, Callum. So first to say that we have not taken the review of rehabilitation beds off the table currently. However, we're still understanding the impact of COVID on the bed base we have in Perth and Kinross. So there's a real balancing act here in terms of where we would go next in relation to continuing with that sort of transformation programme. We need to be quite clear in terms of the impact of that, and plus we also then have other, as you say, other services that we're implementing, including hospital at home, that will afford us the ability to review where we are with our rural community hospitals in particular. So the answer is yes, but maybe not within this year, whilst we sort of try to roll out some of the new models of care and then look at the impact on as we move into the future.
Okay, thank you.
Thank you. Councillor McDade, please, and then John Duff.
Thank you, Chair. Yeah, I just wanted to come on to, it's identified in the report, and obviously it's been identified previously during discussions we've had around this over the past 4 years. It's been ongoing. I remember issues in summer of 2018, and we've had repeated throughout the past 4 years at least. I think it even predates that, around getting staff, retaining staff, and the fundamental underlying issue usually for a lot of these staff has been the affordability of housing locally and the availability of housing. So not just affordability, but also availability. And I note that there is reference, and Evelyn made some reference earlier about accommodation. But my sort of understanding, I think, is that that was more temporary local accommodation to ensure that we had staff who could come up and stay and all the rest of it. And absolutely, that's great for the short-term issues. But what I'm interested in is actually how we resolve that long-term issue, and I would like to know what work, if any, has been done with colleagues in the council's housing team and NHS Tayside's estates, etc., around some long-term solutions in terms of, we're talking about unique solutions for the situation, and I'd say that we understand what the issue is here. And before we redesign services, that we might not be able to safely staff again in the future, because we've been through quite a few different changes to the design here. We have to resolve this underlying problem. So I'm just sort of hoping to hear a bit about what work might have been done, and then, Chair, at the suitable time, I have a request I'd like to make of you in regards to the recommendations around this. So thanks very much.
Okay, Councillor McDade, yeah, just to say that I suppose we need to recognise that the staff that really work in and around Pitlochry do travel into the area. So yeah, I think it's important to recognise, that they do travel into the area, and that is primarily probably because of the cost of accommodation and the availability of accommodation. We have worked in the past with PKC around supporting the key worker status, and we haven't had much uptake on that, in fairness, in staff being able to make that personal choice to go down that key worker status route. So that is still something that we probably need to consider, and maybe consider accommodation in a different way for rural Perthshire in particular. So yeah, the work has been done, but I don't think, I'll bring Amanda in, but I don't think there's been a massive amount of uptake in relation to that sort of key worker status role.
Yeah, thank you, Evelyn. And I think, just to reinforce what you say, the majority of our staff are actually travelling into the locality to support the GP ward. There are only a small cohort of staff that actually live in the surrounding area. So we have worked with our PKC colleagues in housing in terms of that key worker status that Evelyn's described, and we share that information as people are applying for posts. And through interview processes and things, we have that conversation, so we can share it early doors and give people the heads up that there is a process in terms of accessing accommodation. However, as Evelyn said, a lot of staff don't want to go down that route. They feel they want to manage that in their own way, and some staff have been successful in getting rooms in people's houses to support them. But it is a piece of work that we probably need to progress now. We have been asked, could we develop something locally through partnership and Tayside, etc. So that's probably where we're at, and that would be part of this process as we go forward.
Thanks very much indeed. And just say to Councillor McDade, I think the issue about housing for incoming workers to support health and social care is a big issue in its own right. We all recognise that there are issues in remote rural areas, and I'd welcome any future discussion on this, but it's a big issue. And so I'm now going to move on to John Duff, and thank you, and then I want to wrap this one up.
Thanks, Chair. My question was with regard to the non-nursing staff. I'm aware that a number of other staff members have been redeployed elsewhere within the service, and I'm just looking for comfort, if you like, that everybody's been found a position they're comfortable with. But have we also lost some staff from these posts because of the closure of the hospital, or the inpatient unit? Thank you.
Thanks, Councillor Duff, and I'll maybe pass over to Amanda for the detail of that. But I am aware that the staff are fully engaged in the engagement sessions that we have with our nursing staff and our AHP staff within the transition process, although the support staff are not directly managed by ourselves, but we're absolutely keeping them engaged and in the loop. But I'll maybe pass over to Amanda for the detail around the transition process for them.
Thanks, Evelyn. Yeah, I think just as you've said, obviously within the GP unit, we have registered nursing staff, what we have remaining, and healthcare support worker staff, which are managed as part of the Health and Social Care Partnership structure. However, we've got also, as you've said, Councillor Duff, we've got support staff and catering staff, cleaning staff, etc., that are supported in the local way of working, but they're employed directly by Tayside and managed directly by Tayside. So our transition team was set up in inviting managers on from those services to work with me as the chair in terms of that transition process. So as you can imagine, it's been a huge process, and we've had to do it very rapidly to ensure staff, we've met all the health and safety requirements of staff and supported them in terms of their travel arrangements, etc., and that there's no detriment in terms of their pay and standards, etc. So all staff have been redeployed. Some of the catering staff and support staff have been redeployed to Perth Royal Infirmary because that's where they needed the capacity. Staff have been happy to transfer, so all members of staff have had a one-to-one with HR and their staff side reps, where all these options are discussed, and staff almost sign up to this way of working and move to the areas. They're also supported in terms of travel, and as I've said, no detriment to their pay and terms and conditions. So that process has just been completed at the end of last week and confirmed, and staff have been temporarily redeployed within the North locality to our other health services, but as I've said, wider to Perth Royal Infirmary for some of the support staff.
Okay, then. Thank you very much. I'm going to move on now. I have a comment from Gordon Patterson before I come to Councillor McDade's request for an additional recommendation. Gordon, please.
Thank you very much, Chair. So to thank Amanda and Evelyn for that input, that's been very helpful, and hopefully IGB members feel that they have been updated on the situation. And also to thank Sarah Dickey in relation to her professional leadership and oversight and the report that she's given to the IGB from a nursing perspective. I think, Sandra, your comments about communication, we need to reflect on that and take that on board. I think part of the challenges around communicating in this regard, as Evelyn described, are how intensively active we were in this space during the time that things were going on. But that issue and this paper and this discussion also, you know, it's challenging me to reflect on the ability to reconcile a very operational contingency issue with the strategic planning role of the IGB, and I appreciate that we are all still trying to wrestle with that, and absolutely it's important that these are things that you're apprised of, but you know, I was in NHS Gold Command because this is an operational issue that required the NHS board and the clinical director and the nurse director to be involved in supporting a recommendation and decision around this, given the situation that we were dealing with at that time. So I suppose it's just that little reminder in relation to the strategic planning role, and a recognition that that is difficult because these are important issues and they're happening in the Health and Social Care Partnership services that you have oversight of. So I just wanted to acknowledge that, Chair. Thank you very much.
Thank you. Sandra, I want to move to is this a substantially different question before I pick up on Councillor McDade's request for a further recommendation?
No, it was just to add to what Gordon just said there. So I absolutely appreciate the difference between the operational compelling priorities and the strategic objectives. From a public member of the public perspective, you know, this is also about maintaining public confidence and taking the public with us when these kinds of decisions are being made, and continuing to try and engage them in that, so that the decisions that are made, they will hopefully be supportive of and not feel outside of. Thank you.
Thank you, and that thought wasn't lost on me either, Sandra. So this issue about being updated prior to such things happening, and we are fully appreciate the enormous pressure staff were under at the time, with lack of key staff as well. So I'll hold that one there. Councillor McDade, before I move to the recommendation, what was your additional request?
Thanks very much, Chair. I really thank Amanda and Evelyn, and indeed Sarah, Dicky and Gordon for their work around this, and particularly I know how much in the last 4 years that Amanda and Evelyn have done on this and on our other community hospitals, and as I sort of alluded to earlier, I think there is a fundamental underlying problem here, and actually I don't necessarily think that problem is something that Amanda and Evelyn can solve on their own through lots of clever staffing and all the rest of it. I think there is a wider, and I think you touched on this yourself, Chair, there is a wider underlying issue in some of our rural communities about the housing provision, and although we have the key worker status that's been mentioned, I actually think and I know from having spoken to staff who've applied for jobs and in some cases been recruited and they're not being able to take up post, etc. in this, the housing is the underlying issue. I would like to ask for an additional recommendation that before we embark on major service redesign, that actually some work be done more so in partnership with council colleagues and other perhaps third sector partners around what could potentially be done to create some actual key worker housing for healthcare workers in Highland Perthshire. And this is not just an issue that obviously affects the Lockheed Community Hospital, it also affects our care at home staff. Actually any of these sort of provisions that are being discussed in this paper are unlikely to be viable in the long term unless we can resolve this issue. So I have some suggested wording, but I'm very open to what to your consideration on this, Chair. I'll put that suggested wording in the chat for your consideration. I would like to hope that it could be incorporated into the recommendations by yourself. Obviously, if you're not inclined that way, I'm quite happy to move it as a formal amendment, but really I'd like to have consensus on this because I think there is consensus around the board on it.
Thank you for that, Sander. I think my first thought is it directly related to the recommendations within the paper? I know it is a major issue when considering major service redesign, but that's almost like adding another major item into a set of recommendations, which was an update paper on Pitlochry Community Hospital. Now we won't lose anything that you're requesting here. We would hold that, but I think there's an appropriate place to have that discussion. But I don't think it would be strengthened by putting it into this particular document. So I need to be straight with you about that. Gordon, can you comment on this as well before I seek other thoughts on it?
Sorry, having a delay there, including a delay in Councillor McDade's information popped up on my screen, but it's not yet come up in my chat, so I can speak in principle. I suppose Councillor McDade's correct that if he's being asked, I suppose, to approve a recommendation, then he may not wish to approve it, or he may wish to make an amendment to that recommendation. It's perhaps, if the board are all supportive of what it is he is asking us to advance in the context of this challenge as part of the mitigating action, then that should be worthy of consideration. But this is perhaps more of a procedural matter that Scott Henry, our colleagues, might be able to advise on, Chair.
Okay, Scott, can you advise?
Yeah, in terms of process, obviously the board have recommendations in front of them in the report. Is that Councillor McDade is suggesting that we add in his additional recommendation, so that would be one of the other resolutions that the board would take when agreeing the report. So yeah, it's up to the board as to whether it wishes to also agree and include Councillor McDade's proposal as part of the recommendations in the report.
Yeah, I think one of the things that strikes me most about this, it's a very long recommendation, but I'm not sure it would be strengthened by building it into this recommendation. I'd much rather see it given some strengthening, because actually I have full sympathy with what Councillor McDade's saying about affordable housing, etc., and availability. I'm just wondering whether we should raise this as an action point to be dealt with as a separate issue when we're talking about major service redesign, which is what this paper isn't about. So forgive me if I'm not clear on that, but I think that's where my sense is to go with this, so it will be addressed, but not within this paper. I don't think it strengthens it. And I have comment from John Duff.
Yes, thanks, Chair. Yeah, I mean, I'm certainly happy to second Councillor McDade's recommendation if we need to go in that direction. But I feel that obviously resolving the issues at Pitlochry Community Hospital are urgent. I don't want to see any delay in progressing on with the redesign of the model for the hospital, and affordable housing, I think, has to be part of that. Otherwise, whatever design or redesign you put in place, I'm not sure it will falter on the same issue, I think. And I think the affordable housing is a key part of any redesign, and I would certainly like to see it as part of the way forward for the new redesign in Pitlochry. Thank you.
Yeah, I think that's kind of my feelings. Well, any other views on that, please?
Chair, could I come in, please?
Yes, please.
So the Health and Social Care Partnership are currently developing our older people's strategic delivery plan. And I just wondered if, in the context of this discussion, what we should be doing is, when we bring forward that strategic delivery plan, making sure that we're embedding into it some arrangements and opportunities to explore what Councillor McDade has helpfully offered, but to more significantly address issues around access deprivation and delivering services in rural and remote communities, including with a substantive element around housing. So I know that colleagues will be thinking that's a lot to ask to deliver in the next few weeks, Gordon, but actually to take that at a strategic level, to put it into that higher level strategy, and to embed it into all that we do, recognising the geography of Perth and Kinross, and acknowledging the helpfulness of some of the suggestions that are incorporated into this text that I can now see on my screen, would be a way forward. But I don't want to cut across any procedural issues, and I don't want to deny Councillor McDade his position in this regard.
Yeah, thanks very much. Absolutely, and neither do I. I just want this issue to be dealt with in the right place. Councillor Purvis.
Thank you, Chair. It's just to say I agree with the sentiments of what Councillor McDade has put forward. I think this is a long-standing issue that relates to the community hospital, but also is wider than that as well. And my view is always that it's better to formally agree something as the board and give that strategic direction rather than simply agree something as an informal commitment or as an action. So my preference would be to agree it formally. And we'd be happy to support an amendment if you're not inclined to incorporate it.
Yes, I think we've got to the point we need to make a decision on this. I agree with that. So Scott, can you advise us next, because I can't actually bring up the whole of the recommendation. Can you read it out? And I don't know how we would vote on this.
Yes, so I guess, as I say, we've got the recommendations that we have listed in the report, and we've got the additional recommendation that Councillor McDade is proposing. I think from my point of view, in terms of the competency around Councillor McDade's additional recommendations, I don't see any issues in that what it's asking us to do is to note part of the existing report, and it's asking the IGB to request that the Council and NHS Board further look into this in terms of identifying other options. That there's nothing. I think the essence of the proposal, and Councillor McDade will correct me if I'm wrong, is that it's asking the Council and NHS side to look into this further and work together. So it's open to the board as to whether they want to agree this. But if there is any of the members, the voting members, who don't wish to agree this and to purely simply agree the report as it stands at the moment, then yes, we would need to look to get a mover and a seconder to go against what Councillor McDade and Councillor Purvis are proposing.
Okay, can I deal with the recommendations that are already within the report itself, and then come back to Councillor McDade's? Do we support the 4 recommendations which are contained within the report?
Agreed.
Agreed.
Okay, right. That takes us then to Councillor McDade's amendment. I'm afraid I'm having difficulty getting the full script up on my screen here. Scott, can you or Gordon read it out, please?
Well, I'll maybe ask colleagues. I don't know if it's possible to sort of copy and paste it, maybe, and to show it on the full screen. I know that we've sometimes done that in the past, so that if you bear with us for a minute or so, we may be able to do that, because it is obviously quite a long piece of text.
Yes, and I think that's, as I say, I think people are thinking that would be helpful. I wonder if it's possible, can we defer on this and come back to it so we can cover the next paper, please? If that's okay.
I think, Chair, just from a process point of view, we have sort of entered the debate on this item, so it would be appropriate now to conclude this item, given that we've now got a motion on the table.
Mindful of time, and it's. I'll just be mindful of time. It's now 19 minutes past 5.
Bob, I'm not sure of the procedural elements, etc., but I would suggest that I have no objection to what the wording states. It's not detrimental to the work that this paper needs to take forward. I would be happy to support that being an additional recommendation to the paper if it doesn't cause any implications to the other 4 recommendations, and in fact would just be supportive of a direction for future focus.
Yeah, thanks very much for that. I have a difficulty that it's so long I can't actually read it. So,
Chair, may I just add a view on it as well? Chair, may I?
Yes.
Thank you. I mean, I can read it with difficulty, but and I think, like others, I support the sentiment and the direction of where it's going. I think the slight concern I have with it is that it becomes too specific as to the solutions in the context of what is actually quite a narrow issue here. And I think a question, the section, the first part of it I'm fine with. The section that begins, consequently the board requests, and it's asking that Perth and Kinross Council and NHS Tayside work with others to identify key worker housing for healthcare staff. That to me, seems to put a responsibility on, well, firstly, the council may be placed to identify key worker housing. I'm not sure that NHS Tayside is in a position where it can identify key worker housing. But I think it could be something to explore the availability of key worker housing. And then I think the next bit that goes very much into methodology seems to me to be too precise and too prescriptive. So these would be my only observations on it. I think it's a good point in principle. I think it maybe just reaches a little further than it's within our ability to achieve.
I think that's thanks, Donald. I think that's why I have reservations about it. Whereas I would prefer this to be a formal action point that I would have been happy to carry it forward using some of that language. But anyway, it sounds as though that might not be the case and that people may want to vote on it. So Scott, how would we go about doing that now?
Yeah, so I think we've now managed to share the wording on the screen. So I'm taking this as a formal motion from Councillor McDade, and apologies, Councillor Duff, I know you said that you'd second it. So that the motion that we have in front of us is to agree the report, including this additional text. So we really need an amendment to that, which it sounds like possibly from yourself, Chair, or maybe from Donald, in terms of are you actually formally moving that we don't include this in the recommendations in the report? And I think you said that you wanted this to be taken away as an action that would be recorded in the minute rather than a formal resolution within the report.
Yeah, that was my sense of it, yes.
I don't know if Donald, do you want to do you concur? Are you formally seconding that from the chair?
I would prefer, if I may, to propose an amendment to the amendment. And
okay, so just to take us back then, so we've got the first amendment from Bob as chair, which is to not agree this extra proposal and to include this as an action point. So we would then need one of the voting members to formally second Bob's proposal. If there are no members to second that, then that amendment from Bob would then fall. So we would then come into your proposed amendment, Donald.
Okay, so my proposed amendment would be to take Councillor McDade's amendment as drafted until the words Perth and Kinross Council and NHS Tayside, and insert after that explore options for key worker housing for healthcare staff. And then I would finish there and I would delete the rest. So that would be my proposed amendment to the amendment.
So we would now be looking for a voting member to second your proposal, Donald. So if there's nobody to second what you're proposing, we then be back to the original motion on the table. Sorry, Bob.
I was just waiting for people to respond. I would second that if that's within the rules.
Okay, so we now have that as a formal amendment from Donald and Bob. Is there any other amendments from any other of the voting members who wish to put forward any other proposal? So now, Chair, where we're at is we have the motion, which is from Councillor McDade and Councillor Duff, and we have the amendment, which is from Donald and yourself, Bob. So we're now in the situation where, unless there's any further proposals or any other amendments, members now have the opportunity, if they wish, to add any additional comments on the two motions and amendments before we go to a vote.
Any other comments? Okay, it sounds as though we're not having any. I don't know whether. No, it isn't, but I can see.
Okay, so are members clear about exactly what they're voting on, or do we need to clarify that again in terms of the wording?
We may have to do that for the second amendment.
Can I just clarify? I'm finding this pretty challenging because I think we're all saying the same thing and we're just getting tied up in semantics here. I genuinely would support both. I don't see what the issue is that we're going to vote for. This is a paper for us as an IGB, isn't it? For us to use. So I am happy with either wording because I think the sentiment is there and it's just part of the paper and the recommendations that we are passing. So I'm sorry, I'm just finding it a bit challenging as to what we're doing here.
Yeah, I think just again in terms of advice, obviously we've tried to reach consensus on on what the agreed wording would be, but we have now entered in terms of the standing orders a formal situation. So the option to voting members is to either vote for one or the other, or to abstain if they don't want to take part in the vote, which again is fine. So
sorry for my ignorance. I've never been involved in something like this before. It just seems a bit strange.
No, I appreciate it. I know we don't get into too many votes at the IGB, and I guess we need a way which we have in the standing orders in terms of breaking any deadlock. So we're now at the situation where again we have the motion and the amendment. So I think just again in terms of clarity for wording, we've got the original wording there on the screen, which was the proposal from Councillor McDade and Councillor Duff. And I think, Donald, again, if you just want to just clarify once again for us exactly what it was you wished to change. I think you're on mute, Donald.
Yeah, it was first time for everything. Yeah, I wanted to delete this section beginning to expedite this work down to the end, and I wanted the words prior to that, and I can't remember what the exact words I used before, where I think it was to say that Perth and Kinross Council and NHS side work with other partners as a matter of urgency to explore the availability of key worker housing for healthcare staff. And my reason for that is simply, I think, if we take Councillor McDade's wording as drafted, we might be placing an obligation on the council and NHS side that they cannot fulfil.
Chair, just before we went to the vote, I noticed there's a post from Evelyn who's made a comment. I don't know if Evelyn or potentially Gordon just want to, before we actually vote on this, do you have any comments or concerns around the competency of these proposals?
Yeah, can I just come in, Chair? I'm just reading the second part of the paragraph, and for me, the way it reads is, that we maybe have to wait for housing before we redesign, and I'm just conscious of the staff that we've currently got in place that we've maintained, who are currently transitioning to other roles but being maintained for Pitlochry Community Hospital, we need to be careful that the time span isn't so long that we lose our core staff that we've currently maintained. So I think we just need to be mindful of the wording. I'm not opposed to looking at and you know, NHS, Tayside and PKC supporting the need to look at accommodation, but to do that in the context of being able to continue to redesign, I think is important. Because redesign takes a long time as well.
Scripts, we need to have both amended scripts, because that's why we're only looking at one at the moment. So we need to have Donald's amended script as a second one. So that needs to be copied in and delete the bits that he didn't want, because at the moment we're only looking at one.
Scott, I'm happy to take on board Evelyn's comments and change the final section to identifying solutions to this issue alongside work on service remodelling, and I think that covers Evelyn's problem that she's raised there.
Okay, yes, I think it may be then helpful to have both the amended text from Councillor McDade and also the text from Donald as well, so that we can just definitely compare those two, so that we're fully clear about what we're deciding.
Scott, I think I'm screen sharing and I've amended Councillor McDade's proposal on the version that I think I'm screen sharing, but I wasn't proposing to try to capture Donald McPherson's. I don't know if somebody's doing that.
I'll be guided by my colleagues who may be working on this in the background if we're able to pull these up.
Are people seeing the version that I've shared, which I've recently just typed? Yeah, good.
Yeah.
So, I mean, the bits that, that Donald was, I mean, probably content with.
Yeah, if you bear with us, I think we're just pulling it all together. So hopefully we'll have it on the screen shortly.
Okay. Well, I stop sharing.
Yeah, that's probably a good idea. Yeah.
Probably not the role of the chief officer anyway, but hey ho.
Well, this will certainly be a memorable last meeting for you, Gordon.
Sorry, I'm muted.
Chair, if it helps, and it may not, I have just put into the chat my revised and shorter text.
Yes, I can read that clearly.
So perhaps if Gordon was able to screen share again the Councillor McDade's text as revised by him, and at least you could look at them side by side. And
if you could just hold off, Gordon. I think we're Magda and Adam are just pulling this together. I don't want to diminish your role in your last meeting as Chief Officer.
No, I don't want to fail to comply with guidance and advice from the clerk to the board, Scott. If we get there. I mean, it's really that wording around to identify or to explore, isn't it? And where the fun and the later part of it, Donald, yeah.
Yeah, I mean, I think my point is the later part of it is too directive. Yeah. And the earlier part, my specific change is because it's certainly not within the scope of NHS Tayside to identify key worker housing. That's not what a health board does. It may be within the scope of the council, but that I have no knowledge of. But I just don't believe that we can place that obligation on the two partners. But we can ask them to explore it. So I'll not repeat it again at this point.
Chair, I wonder if we might now, please, can I move that we move to the vote on this?
Thank you, Councillor Drysdale.
Before we vote, could we not ask if Councillor McDade would be happy with the edited, because it is in essence what he said, it's just edited, if he was happy with that, or is that what the vote does? Because I'd rather not vote on one versus the other. If Councillor McDade was happy that concisely says what he had said at the beginning anyway, it conveys the message.
Beth, if I may, the standing orders do say that if a voting member has to go to the vote, then we go to the vote.
Yeah.
Okay, cheers. Yes, I'm comfortable that I think we're not going to resolve this by consensus, and we have a division. So we have the two proposals, and as long as members are now comfortable with the wording of the two in the chat, then I suggest we move to the vote. So what we're voting between is the motion, which is the proposal from Councillor McDade and Councillor Duff, and we've got the amendment, which is from Donald McPherson and Bob Benson. So I'm asking, I'm going to actually pass to my colleague Adam, and he'll now take a roll call of the voting members to confirm whether you're voting for the motion or the amendment.
Thanks, Scott. So as Scott says, members, if you could just indicate whether you're voting for the motion or the amendment. Bob Benson.
Not voting for the motion. Voting for the amendment.
Okay, thanks. Councillor Drysdale.
Motion.
Councillor Duff.
Motion.
Beth Hamilton.
Amendment.
Pat Kilpatrick.
Pat left at 5 o'clock, Adam.
Okay, thanks. Councillor McDade.
Motion.
Donald McPherson.
The amendment.
And Councillor Purvis.
Motion.
I've got 4 votes for the motion and 3 for the amendment.
So the motion is therefore carried, the proposal from Councillor McDade.
Okay, thank you very much. And that presumably that's added to the existing recommendations that we have. Thank you very much, everyone. And I now have to move. I'm looking at the agenda now. It's now 17:40. And what I'd like to do is I have a request from Jackie Pepper to make a very brief statement on the Adult Protection Committee annual report. But can we take the minute of the meeting of the Perth and Kinross Health and Social Care Partnership as for information and just note that.
Noted.
Okay. In terms of governance, Audit and Performance Committee, verbal update. Callum. As Callum has indicated that he will give a written update, which is fine. We'll accept that. Thank you very much. And then 10.1 for information, Perth and Kinross Adult Protection Committee Annual Report 2020-21. Jackie, you wanted to say a couple of important things about this.
Yeah, thank you very much, Chair. It was really just to say that, you'll know that there's a legal requirement for adult protection committees to prepare a report every 2 years, and in Perth and Kinross we do that. We produce that annually, and that's good practice and supports regular scrutiny of the continuous improvement that's been taking place. And this report was endorsed by the Perth and Kinross Council at its meeting in December and is brought forward today for noting, but neither Bill Atkinson, the independent convener, or Ian Wilkie, who's the lead officer for the committee, are able to attend. And what we're proposing is that a development session will take place on the 13th of April with the focus of adults and public protection, and there'll be an opportunity to discuss the work of the Adult Protection Committee itself, any aspect of this report in detail if anyone has any questions, and also I think importantly, and that's why I wanted just to get the time to say this, that we will also provide an update on the self-evaluation and position statement that's being prepared for an imminent adult protection inspection, which we're anticipating will take place at some point in the current year. So that's the important aspect of carrying this forward into the session in April. Thank you.
Thank you very much indeed. So I think with that information to hand, and we will have further opportunity to dive deep into this this issue, we can now note what has been said, and we can move on to the Integration Joint Board Reporting Forward Planner, which is there for information. And we have the future IGB meeting dates and the development sessions, of which one has just been alluded to on the 13th of April. Okay, that's the end of our formal business. I think what I would like to say, ensure that Gordon is suitably recognised for his contribution to the IJB. And I took the opportunity to ask Councillor Drysdale, who was the substantive chair throughout virtually all of his time when he was in post, and I'm relatively new. And I've asked Councillor Drysdale if he'd say a few words on our behalf as a board. Thank you, Councillor Drysdale.
Thank you, Chair. I've been looking forward to this all afternoon. Gordon, the chair has, as he says, asked that I say a few kind words about you. Now that's quite a challenge. Not the kind words, but the requirement to keep this short, especially at the end of what has been another long agenda. Gordon's public sector career to date has already spanned 35 years. I'd like to say he doesn't look old enough, but actually, after 3 years in this post, you do, mate, you do. I was a member of the panel in early 2019, which interviewed a number of individuals before selecting Gordon as the outstanding candidate. It was a unanimous choice, and one that I know I and the other members of the panel have not regretted for one moment. Gordon arrived here at Perth and Kinross Health and Social Care Partnership in May of that year, following a 5-year stint as Chief Inspector Adult Services with the Care Inspectorate. Previously, he had also held a role within the Scottish Government as a Policy Manager, Social Work and Social Care. Scarcely could there have been a better apprenticeship for the extremely challenging role he would face over the last 3 years. Gordon has also held the position of Director within Perth and Kinross Council and NHS Tayside during that term, and I personally can relate closely to the challenges that wearing these multiple hats brings. Gordon's role as Chief Officer involved lead responsibility for oversight of an annual spend of over 200 million of public money, of course, adds considerably to the weight of office. But of course, back in 2019, when he assumed the hot seat, nobody knew there was a global pandemic around the corner that brought with it unprecedented pressures of office. Difficult decisions directly affecting the lives of the people of Perth and Kinross whom we all serve had to be made under Gordon's leadership, very often in the evenings and at weekends, and in the splendid isolation of lockdown at home. Therefore, without the opportunity for normal chat and support among colleagues other than via telephone or the dreaded Microsoft Teams that we all so much enjoy. It takes a special type of person to cope with that level of responsibility. Unfortunately, Gordon is that type of person. However, what singles Gordon out is what his colleagues say about him, and I have carried out my very own mini stakeholder consultation. No names, no pack drill, but one senior officer has told me, and I quote, working with Gordon, it has been an absolute pleasure. His humour has helped the executive management team through very difficult times. He has been a source of support and guidance to me personally, and I will miss him enormously. I think the pandemic meant we have forged extra special bonds. Perhaps that's why we'll all miss him so very much. And not just EMT. He formed a rapport readily with staff at all levels within the team. And another colleague remarked, "It has been an absolute pleasure working for him. He makes me laugh most days, frustrates me most days, and I will miss him very much. He is the best boss I have ever had." For myself, as chair over these last 2 difficult years, I have wholeheartedly, and I would have to wholeheartedly endorse these comments. We have had a very strong working relationship. I hope you will agree, Gordon. And the HSCP and IJB have been very fortunate to have you. And I thank you for your executive leadership throughout these extraordinary times. You now move on to become Director of Social Care at NHS Education for Scotland, and we all wish you well in your new role.
Thanks very much, Eric. Those are lovely words, kind words. And I just want to say... Oh, yeah. No, I really appreciate that. I'm a bit lost for words, which is not like me, and I am acutely aware that it's 10 to 6. I'm going to go and have to apologise to my wife who booked a table for dinner at 5:30, but she should know by now. Maybe I'll have to take her somewhere nice. No, thank you very much. Working in this role has not been without its challenges, but I will always reflect on how proud and privileged I've been to be part of our collective endeavours, but particularly obviously those of the partnership in seeking to mitigate the demands of the pandemic on citizens and communities, on staff and on services. I've been overwhelmed and incredibly proud of the people that I've worked with for their compassion, their versatility, their diligence. I do kind of regret that I don't think I've necessarily conveyed to the IJB as effectively as I could just how hard and how effective people have been working. but please be assured that that is the case. And I'm just grateful to have been part of this. I think our response to the pandemic in Perth and Kinross Health and Social Care Partnership, thanks to the support from the IGB, has been okay. We've done all right in the most challenging circumstances. We've stopped some really bad things happening at times, and we've made a real important difference. And I take very little credit for that. That's the effectiveness of collaborative leadership, compassionate leadership, and people working in partnership. So thank you all for that, because you've all contributed, and thank you for your good wishes. And maybe we'll lift a glass in a non-virtual world at some point in the next 6 months or so as we start to find our way into a new normal. Thanks very much.
Yeah, and thank you so much indeed, Gordon. And we wish you great luck in your new job with the NHS NES, and particularly your social care role. It will be very familiar to you. I think you've got lots of opportunities there. Thank you so much indeed. I can now draw the meeting to a close, and
Councillor McDade was just wanting to say a word.
Pardon, sorry, what was that?
Sorry, Bob, I think Councillor McDade was just wanting to say a word.
All right, sorry, Sander, carry on.
Yeah, no, thanks, Chair. And I just wanted to thank Gordon actually as the other one of the other members who has been here throughout his tenure, that he has had not an easy gig at all in the slightest, and he has shown remarkable leadership through that period, that difficult period. And although we haven't always agreed, it's quite difficult to always agree with me, Gordon, we have always had a respectful debate around matters, and I'm very grateful for that. And I wish you all the best. And I don't want to delay you from getting to dinner any longer, so I will keep it short, but I will send you wishes separately. But thank you very much for your work on behalf of the IGB, Gordon.
Thank you very much, Sander. Very kind. Thank you.
Okay, thank you very much indeed. Thank you. Good luck, Gordon. Bye-bye.